And good morning. It's 9 o'clock and we're going to start the 11th Annual Veterans Summit virtually. So this is a bit unusual for us. We've done 10 of these live and in person in Western Wayne County. I'm Jim Fossone. I'm one of the attorneys at Legal Help for Veterans, which has been co-hosting these programs with the Canton Community Foundation for now going on 11 times. We have with us today the chair of the Canton Community Foundation, Steve Snyderman. And in a minute, I'll ask Steve to say a few words about the Canton Community Foundation and talking about its involvement in the community and also about its involvement with the Veterans Summit for over a decade now. So we're glad to have everybody attending today. We have over 90 people registered. We're also broadcasting this on YouTube. We'll pick up more folks there. So it becomes a way to get the message out to veterans, their family and their friends about the available benefits. Those might be healthcare. They may be about disability benefits. They may be about education. They may be about employment. So what we've tried to do today in this virtual summit is provide you some information on all of those. We have a number of pre-recorded sessions, and then we'll have a live Q&A panel where you can ask questions. I'll go into more of the timing of when various things will be on the screen after Steve Snyderman's comments. I'm waiting for Steve to click off his mute and click on his video. And there we go. Thank you, Steve. So let me reintroduce. This is the chair of the Canton Community Foundation, Steven Snyderman. He's been actively involved in the Canton community for years now, both in this capacity, but also as a trustee of the township. Steven, as always, we're thrilled to have you involved in the summit and want to give you the opportunity to talk about the Canton Community Foundation.
Sure. Thanks so much, Jim. Hello and good morning, everyone. I'm Steven Snyderman, chairman of the board of the Canton Community Foundation. On behalf of our board and our administration, led by our president, Beth Mead, who many of you know, I'd like to welcome you to the 11th Annual Veterans Summit. CCF has had a long history of assisting our military community through this summit and other veteran programming. In fact, for the past 25 years now, we have managed the Memorial Veterans Park in Plymouth. And for the past 32 years, we have been serving the communities of Western Wayne County by providing grants and offering programs to make our neighborhoods great places to live, work, and play. We invest in the causes that you care about, one of those being the needs of our military veterans, their families, and their caregivers. And to ensure the success of our and other foundations, all of which support many great causes like this one, last year we started the Local Impact Alliance to provide those charitable organizations the tools they need to continue to thrive for years to come. Currently, our LIA umbrella spans the Canton and Plymouth Foundations, the Giving Hope Giving Circle, the Porch Program, and the Kids Coalition Against Hunger. We will be adding more in the coming year. Now, I don't need to tell you all this has been a rough year. In this uncertain world, it's more important than ever that you know all the services that are available to you. That is why our team works so hard to bring you this event, even if this year it has to be done virtually. Like with so many events this year, we're disappointed we could not all get together in person to provide you this important information. Our hope is that we will be back together this time next year. Until then, I wish each of you the very best. Now, before I finish, I would like to thank Jim Falsone and our event partners at Falsone Bone for another great year of providing this event to those in the community who have served our country so valiantly. I'd also like to thank our event sponsors, Jack Demmer Ford and the Community Financial Credit Union. Thank you for your partnerships. Stay well, everyone. Enjoy the presentations. And now I'd like to turn the program back over to you, Jim.
Thanks, Stephen. And I would tell folks that if you want to know more about the Canton Community Foundation or how you can assist in the mission that it has and have an impact on any of those funds that Stephen identified, please go to cantonfoundation.org and you'll get redirected to the appropriate spots. So cantonfoundation.org is how to stay on track with what's happening in Western Wayne County and certainly in the foundation and its related activities. Thanks, Stephen.
Thanks, Jim.
As we move on, I've got some administrative things to talk about before we get, I throw it over to one of Legal Help for Veterans attorneys, my colleague, Christina Darrow. I'll turn it over to her in a moment. But a few things, and maybe I just violated rule number one, which is I gave you a website without telling you ought to grab a paper and a pencil or a pen to write down some of the information. And certainly, as the day progresses here, you're going to hear things from our speakers where you go, I didn't know that. I better make a note about that and talk to my husband or my wife or my uncle or grandpa. So please expect that to happen throughout the morning where you have a note you want to make. So get yourself ready with that. You can grab a cup of coffee and have a piece of paper there, and we'll throw out some more interesting information that you ought to jot down and follow up on. And certainly cantonfoundation.org is one of them. Stephen mentioned our sponsors. You'll see some more about the sponsors as we go through the morning. Again, you can't do these kind of things without some help from the community, financial help to keep things going on. So Jack Demer Ford and Community Financial, again, sponsoring this summit, helping out Canton Community Foundation, and we're really appreciative of that. So here's one of those things where you might want to make jot some notes. In the good old days you'd have had last year and for the decade before, you would have had a program book in front of you. And in that program book, you would have been able to make notes, but you'd also see what times various people were coming up to speak. So I want to talk about that so that you can plan your coffee runs accordingly. So we're going to start first with Jenny Kriesman from the VA health system in Ann Arbor. That's from 9 to 9:30 or so. So a little after 9:30 it'll end. And then 9:30 to 10 roughly will be Zaneta Adams for the state of Michigan, explaining what's going on. And then roughly 10 to 10:20, all this is going to slide a little bit because I'm talking too long, will be the director of the Michigan Veterans Homes. And then 10:30 to 10:20 to 10:50 will be Jeff Hall from the DAV talking on a national perspective about employment issues. And then the much anticipated live Q&A. This is the, when we're together, this always generates a lot of interest. So we'll have a live Q&A session. I'll remind people now on Zoom down at the bottom, if you pull your cursor to the bottom, there's a chat function and there's a Q&A function. Christina Darrow will tell you some more about this so that you don't forget it in front of the live Q&A. But we've got a great group coming in for live Q&A for an hour from roughly 10:50 to 11:50. We'll sign off and be done by 12. So that's the schedule. About every half hour, things will change or so. So stay with us as those things change and make sure to send us your questions and chats. And with that, I'll toss it over to Christina Darrow. As I mentioned, she's a attorney here at Legal Help for Veterans, and we've been doing this for 11 years. Christina, this is the first time you and I are doing it virtually, but you've been with me for all 11, so I know you know how to make this run smooth. So we appreciate, again, all of our partners. And I should mention, behind all this technology is a guy by the name of Andrew Brockman, who's been making sure this works, and I'm sure it's going to run smooth. And Andrew, stop worrying, it'll all work out. So Christina, with that, I'll toss it to you.
All right, good morning, everybody. A little bit odd this year, but we are back and ready to go. And our first speaker is Dr. Jenny Kriesman. She's been with us as a speaker at several of these summits in the past, and we're very happy to welcome her back again this year to be able to speak with everyone. She is the Medical Center Director at the Ann Arbor VA, and she's been in that position since February of 2018. She's been the recipient of several prestigious awards in the VA world. She's received the Federal Service Excellence Supervisory Award, and she's also received the Secretary of VA's Hero Award for her service to veterans following Hurricane Katrina. And she also has degrees from both the University of Kentucky and Morehead State University. And so we'll allow Dr. Kriessman now the opportunity to provide all of us with some updates on the VA healthcare system.
First, Jim, I'd like to thank you for inviting me to have this opportunity to share a little bit about the VA Ann Arbor healthcare system. Again, my name is Dr. Jenny Kriessman. I am the Executive Director of the VA Ann Arbor healthcare system in Ann Arbor, Michigan. And just going to the first slide here, I just want to just show you our facility there. And also over this past spring and late winter, we actually went through a surge of patients that were ill. And we did a lot of things to help and support them, but also to help and support our employees. And so there you'll see a nice display called Heroes Helping Heroes. In addition, I'll draw attention to the logo. It says Moving Forward Together. You know, as we come out of our first COVID surge, we've actually been put together a program called Moving Forward Together, that allows us to keep a lot of the things that we learned during this past few months, but also bring forward some different ways of doing business in order to meet the needs of our veterans. So I'm going to go to the next slide. So I'd like to just start with just sharing with you about how the VA and the VA Ann Arbor healthcare system is provided support to our veterans, those with and without COVID, over the last 6 months, and also a little discussion about our fourth mission. So up to date, probably up until July, the VA Ann Arbor has treated about 142 veterans that have tested positive. We have actually 110 of them have fully recovered. We have, in any given time, several that we're monitoring and supporting. And unfortunately, we did lose 16 veterans. But overall, we did a very good job in managing the patient population. We learned a lot, as many did throughout the country, and we are applying them as we move forward. In addition, because we did such a good job of getting prepared to meet the needs of our veterans, we were able to lean into our community and support about 31, actually a total of 36, but 31 positive COVID non-veterans, in addition to our veterans. So that was good because, as you know, employees in our community is important to us, and if we have the opportunity to support them and still provide the support to veterans, we wanted to be part of that. Unfortunately, though, those 21 of those went on to do very well and recovered and are no longer actively being monitored at the healthcare system. Unfortunately, we lost 10 of them. We, again, same situation with our veterans, always trying to figure out how to create a positive and supportive veterans and non-veterans. And hopefully moving forward, we've learned a lot and we can keep creating that change. Just to be fully disclosed, the VA Ann Arbor healthcare system has had about 55 patients that have tested positive, at least that we know, of employees. And of those, 53 employees have fully recovered. And that we are very thankful for that, because these are the folks that help us meet the needs of our veterans every day, and them being healthy and strong is important to us. We have 1 or 2 at any given time that are being actively monitored at home. And unfortunately, we did lose our first employee in March. And that was a bit of a sad day for us too. So we, again, continue to learn, continue to implement and support not only our employees, not only our veterans, but also we help support the community. So it's a little bit of a history in case anybody ever asks you what our role has been up to this date. But going forward, it has a little bit of uncertainty to the future, right? So we keep hearing, what you see there in the orange is, what has happened, right? The large surge in cases and the managing them up and then going towards the tail. And then that's great. And we were able to manage through that. We were able to do it safely, effectively, with enough resources to meet the needs. But we're also looking at what we refer to, what's the future look like? Is it going to be a second wave, as it did played by the blue line there? Are we going to see a huge surge in the fall? That's the big conversation this day. Or are we going to see maybe a big wave and what we call an oscillating wave of COVID patients? And that's the kind of ups and downs over a period of time. It still remains to be seen, but I will tell you, we are preparing either way, we're preparing to meet the needs of our veterans moving forward, however this disease comes back and however it impacts us. So that's actually starting today. So we're actually, just to kind of give you an idea of what we're working on, right now we're well positioned to advance our work in recovery. So we have right now, as we're knowing that the surge is coming and that we might have some issues, we're still in what we call recovery phase here at the VA Ann Arbor Healthcare System and at all the VA facilities. And we are actually put a lot of pieces together just to support our veterans going forward so that we can meet their needs. We think there's been some deferred care that at the time was all right. I can go a couple months without a teeth cleaning, or maybe that pulled tooth is not hurting me at that time, but eventually it's going to hurt me, or I'm going to need to get those teeth cleaned. So we need to position ourselves so that we can bring those veterans in and get their needs met effectively and safety. So I will tell you, we have a very strong position when it comes to personal protective equipment. We have about a 60-day supply, and our intent is to keep it at that level so that we can be prepared to meet the veterans' needs. We have good testing capabilities here at this facility. We have like 3 different testing forums that allows us to test for patients that are being admitted to the hospital, patients having certain procedures, and of course those that present with symptoms that are ill. So we are working to keep everybody safe. We have, again, strong processes in place to protect our veterans. If you come to the facility right now and you're seen in any one of our facilities, including our offsites, you're expected to wear a mask for your safety and our safety. You'll see our clinicians in mask, and all our employees in mask, and all of our clinicians are folks doing face-to-face care with mask and face shields. Again, just to keep everybody safe. And we are consistently, like most of the other healthcare systems, we see this as a window of opportunity, and we're operating at about 100% pre-COVID capacity, which means we are bringing in veterans. We've always seen about 80% of our veterans from the virtual care capacity in primary care, about 90% from a virtual care capacity in the last 6 months for mental health. And what it had really had gone down to a low capacity, it was our specialty care, right? Procedures and surgeries and things like that we've kind of postponed. We're up fully running. Our ORs are up and running. We're doing procedures. We still have our virtual first model, which is if there's anything we can do for you virtually first, we're going to do it. And if there's some things where there's a procedure and you have to come in, we're going to make that happen too. So just letting you know, we're now up to about 100% of our primary care and mental health and about 80% of our specialty care as we were before. And we've also brought in our learners back into the healthcare system with our, with our affiliations with the University of Michigan and other universities. We are actually bringing our learners back to the table and in support of our veterans. So I just want to share with you on the other side here is our visitors guidelines. They're always changing, but based on what's happening out in the community. But I will tell you at this time, we are really trying to limit the number of visitors. If visitors come to visit our folks in the inpatient setting, we're actually going with one visitor for a short period of time. If they're coming to support a veteran, where like say my veteran needs somebody to hear for him or something like that, then we're asking to make arrangements. But if not, then we're asking folks to please come by themselves. Again, just in support of keeping everybody healthy and strong. What are some things that we're planning on in the future so that we can meet the needs of veterans wherever they might be here in the Michigan market? Well, we're actually in the process of expanding our ICU. We have a new state-of-the-art ICU coming on this month, and it'll be fully operational in the month of September. That's great, but we at one point we were going to close the other ICU down. We feel as we work through this surge, next surge or potential surge, that we need to have all the resources available. So we have an extensive ICU expansion plan going on. It also supports other ICUs. Additionally, we are hiring about 60 ICU nurses or nurses in the community. So if you have folks that are nurses, or as you can see here, EMS or housekeepers or medical support assistants, If you go on to USA Jobs right now, we have several job postings out there. And we do this for two things. One is to prepare for the future. In the event that we do have a surge, we want to make sure we have enough housekeepers to keep the place clean. We want to have enough ICU beds and employees to take care of our patients, whether they be COVID or non-COVID. And we need folks to answer our phones and to make appointments and listen to our veterans. So we almost have up to 200 positions that are on USA Jobs, and we're looking to hire. So that helps with our search. The other thing that it helps us is that, many of the healthcare systems in the community are actually doing reductions in force. They've been hit hard financially. Melissa asks us to work with our colleagues that are strong and bring them into our healthcare system in support of veterans here and then also in the community if we get called upon. We're working on some other projects that we realized through this process. The scheduling has been difficult and a bit of a struggle with all the different VVs using the virtual care environment or the face-to-face. So we're working on a modernization of that. We also hired what we call a Geek Squad. With many folks, the system is not always the VVC appointments, the veterans visits appointments are not always easy, and we need to move away from the telephone. We want to be able to see folks if they're going to do a virtual appointment. So we're hiring about 10 individuals there that will not only work with our providers and teaching them how to use the system and fully implementing and being more available and stronger with our virtual environment, but we're also hiring folks that will go out and help and support our veterans in that process too, because many times that's the limitations are is they might not have the right equipment or know how to get onto their first appointment and stuff. So we're actually working to have a two-pronged approach to help veterans going forward. We've done a lot of market-based collaborations. I would say as of today of me recording this, we actually have moved our CLC up to Saginaw, and they've been very supportive of us, but because we had to expand in our acute med surge and to meet the needs of our veterans. And we would just continue to work together to support each other. I will tell you that a small portion of our CLC will be coming back online next week. It will mostly be doing a lot of rehab care. And we'll still be working with our community partners and our VA partners to support each other as we work through the next few months. Some of the recovery work we're doing, I just want to let you know, we're working on being a comprehensive cancer center with navigational support and kind of a hub. That means we're going to be like the hub for the whole state of Michigan. You come here, you can get your comprehensive cancer care. We have a virtual component. We'll have a center of excellence, and we'll be able to support our veterans moving forward. We have expanded our surgery program, and we're working on, we had 7 operating rooms. We're working on an 8th operating room, hired some additional neurosurgeon time and orthopedics time so that we can meet with our needs of our veterans in those 2 areas. We've also started a comprehensive pain and integrative medicine program. We've always had this kind of East meets West. We've always had of course, the medication and the pain implants and all those different things that manage veterans from a kind of a medical approach or a Western approach. And then we have this kind of Eastern approach, which is our whole health implementation of, biofeedback and TENS and acupuncture and chiropractic care. And we've actually brought them together and integrate them so that we can make better decisions working with our veterans and add a broader resources that help manage pain and recovery moving forward. And we've also invested in our admissions and transfer operations so that we still have veterans that want to come to us that are out in the community, and they often don't know how to get here and how to make those dialogues and conversations. So we have a group of folks working together on that. So again, a lot going on here at the healthcare system, fully operational, and looking forward to continue to meet the needs of our veterans, even as the landscape is changing out there. A couple things that I just wanted to share going forward that Congress there's actually, they're thinking or they're put forward a request and sponsored a bill to name the healthcare system, not the healthcare system, but at least the facility here in Ann Arbor, the Lieutenant Colonel Charles S. Kettles VA Medical Center. And of course, a lot of folks know about Lieutenant Colonel Kettles. I had the greatest opportunity of meeting him when I first came back here in 2018 or 19. And he was just a bundle of joy. But he, of course, he's received the Medal of Honor from President Obama in 2016. And we're looking forward to have such an honor of being named after Lieutenant Charles Kettles. So just wanted to give you all a heads up that that's out there. We're really, truly looking forward to this, and hopefully it'll make it through the congressional hoops here in the near future. Additionally, when I was talking a little bit about the cancer care program, one of the things that allows us to be a center of excellence there is we actually have our first Fisher House in the state of Michigan. I think Detroit will be having one coming on in about a year, but we have our first one. It opened up June 1st, and I can tell you it's marvelous inside. It's a marvelous space, marvelous place. Has a lot to offer to our family members. And it's already seen well over 100 families. And those families have come from all over Michigan, Northwest Ohio, Indiana, Colorado, and Florida, just everywhere. And the average stay is about 2 or 3 days, but we've had a couple folks here for a few weeks. And I need to tell you that having this house and the ability to support our veterans has gone a long way. I got a lovely letter from a lady who was just thanking us for having the Fisher House because she had brought her veteran here to get health care and services, didn't realize he was going to be admitted, didn't know how to get back and forth from where she had come from. It was a long distance, and really thought that she was going to have to sleep in her car. And when she found out we had this and she stayed, not only was it a blessing and a place for her to stay, but she said she'd never stayed in such a nice place before. So again, if you have the opportunity, just know that this is one of the services we can offer to our veterans, and helping their veterans and their families be supported during times of healthcare need. Just to talk about a little bit in the future, this is the Canton CBOC. It's actually probably most likely going to be in 2022, probably late 2021 or early 22. It is going to be located in Canton. It's a 3,700 square foot facility. It'll have a primary care, virtual care, mental health services, and then as you can see, as expansive as it is, we're looking to see about having some of those complementary alternative services such as yoga, tai chi, and other items to meet the needs of our veterans in that area. We think this will make it be a lovely place for the veterans that are kind of, there's Ann Arbor and there's Detroit, and this is kind of halfway in the middle. So we think it'll serve a good growing population of veterans in that area and meet their needs closer to home. And we're just really looking forward to it. Groundbreaking has begun, and they have started clearing the spaces and preparation for building this area. So just wanted to share with you, these are some of the renderings of what the facility is going to look like. Also, I wanted to let you know that the VA has started an endeavor where they are doing what we call an as-built. And as-built, when you look around, there are pockets of places where we don't have good coverage for primary care and mental health services for veterans. And so a couple years ago, the VA endeavored to perhaps work with, local healthcare systems or office spaces and stuff in order to create leases where quickly you can move into a space that's already built, as built, maybe add some IT and a couple of things you need for taking patient care, but you didn't have to do a lot of renovation or build a CBOC like we're doing in Canton. So we actually have been approved for 2 of them. The first one is in Livingston, and the second one is in Lenawee counties in Michigan. And this allows us to meet the needs of our veterans in those areas. They're small, going to be probably most likely in partnership with other healthcare systems that are out there that might have some free space, not free space, but open space. We'll do a lease with them, and they're meant to be there for about 3 to 5 years in order to support us going through the other pieces that we might have to go through in order to get a building or a lease out there. I'm really looking forward to it because I know that especially the folks in Livingston and Lenawee, they've really wanted to have some of their own services closest to home. And this will allow us to essentially meet those needs hopefully quickly. I'm hoping within this next year or maybe even the next 6 months, make a presence in those areas in support of the veterans. So both clinics will offer primary care, mental health, and also virtual care, at least initially. I already alluded to it, but we have a new state-of-the-art ICU that's coming on. It should be actually, I think we're going to get it turned over to us in a week or two, and then we'll do the preparation and get ready to go, and then we'll be moving all of our patients into this ICU. The older one will probably do some touch-up and again prepare to have that ready to go into the future, because we just think anymore, if we're going to have this COVID and still need to treat patients that are non-COVID, that we have to create safe spaces, and we're just really looking forward to having this opportunity. So that's our new ICU. Unfortunately, I won't be able to do a grand opening simply because I can't have those many folks in the area, but we will do some type of virtual tour just to show folks what we're working through. The other thing too is right now, if you come into the healthcare system here, in particular the Ann Arbor site, you'll see we're doing a lot of upgrades on the first floor. Some of the things we're working on, and that's after you go past the Welcoming Center, is a new and expanded blood draw center. It's just definitely been too tight back there. We're relocating some of our specialty clinics. We're adding a whole new women's health clinic. And it's going to be nice in the fact that it's all for our women, but also creates a state path for them to travel from the main entrance into this new facility. So these folks will have their kind own of entrance and into their own clinic. And so we're really looking forward to that. But we're working through that right now. If you come into the main facility, you'll see where we're starting to shuffle things around and create these new spaces, again, in order to meet the needs of our veterans. So going forward, there's a couple things I wanted to share with you all going forward, because it's truly going to make an impact, at least in the fall. We actually, we have new guidance that came out that really it kind of impacts from two perspectives. The first is a flu shot is going to be crucial this year. It's very hard to tell the difference in many cases between COVID and flu, but it's essential that we have that. So we actually have the testing capabilities, but we're going to strongly encourage people to, veterans and employees, actually for the first time, employees, it's going to be a mandated expectation, which is pretty much consistent with the private sector. But we're going to mandate it, and pretty much unless there's a couple medical conditions or a strong religious belief, for the most part, all of the employees, all the healthcare personnel, whether they work here on site or they work at home, will be required to have a flu shot. But we're really strongly encouraging this for our veterans. We were ordering more vaccine. We're going to look at having an increase our access to the flu vaccine. We're going to have drive-by vaccine shots and just different things like that in order to help people meet the need, because we know there's studies that are starting to say that if you have a flu vaccine, that it helps if you get and end up getting COVID. It will actually help in reducing some of the symptoms or the outcomes, or improving the outcomes. So we're truly this is going to be a national push. It's going to start in mid-September. It's going to have a quick turnaround time. And we're just going to be looking for different ways to meet the needs of our veterans and get them their vaccines, and all of our healthcare providers or personnel. So really, I just want you to understand where we're coming from. We're a high expectation. You might be asked several times, but hopefully we'll get to the point where we'll have, greater than 90% of personnel and veterans vaccinated and have an impact. Just so you know, this facility does have the ability to test for both flu, influenza A and B, and for COVID. And so our secretary has asked us to be strong, to build up those supplies so that we can be quick to meet the needs of veterans, whether they have flu or COVID or both, or whatever it might look like when we go forward. A couple other things too, just going forward, we're going to be adding specialties down to our Toledo CBOC area. So if we felt that that's a place that's underserved, it's interesting when we would send our veterans out who didn't want to travel to Ann Arbor, say for a cardiology or neurology appointment in Toledo, we'd send them out to the community. But unfortunately, either the community didn't have capacity, or they'd still end up having to drive a good distance. So we've decided that we really need to meet the needs of our veterans there and add a few specialties. It appears to be a bit of an underservice. So we've been working with the University of Toledo Medical Center, and we're bringing on cardiology, urology, neurology, chiropractic here in the near future, and dermatology, just so that we can meet the needs of our veterans closer to home, in addition to all the virtual assignments we're doing, in addition to the VVC. We're hoping that this will help support veterans closer to home. I want to tell you through this time frame, we have been very fortunate as a healthcare system. We solicit from you all feedback on how we're doing, and you give us feedback. And I will tell you, it's great because we take it, we incorporate, we learn, and we try to improve the way. But right now, the VA is significantly improved in their trust factor at a 92%. And so many folks are really appreciating what we have to offer, and they're giving us feedback, giving us opportunities to correct if we need to correct, but also giving us feedback if we're doing things well. So just want to share that we're really, even during all these hard times, the veteran experience is still moving in a positive direction. The only other thing I would, as I already indicated to you, we tend to work as a market and support our veterans wherever they might be. We have actually are all regularly meeting together, regularly looking at different ways that we can support our veterans. As I kind of alluded to before, when we had to close our community-based long-term care here in Ann Arbor, the folks in Saginaw and the folks in Battle Creek took those patients for us and treated them sublimely. And then they, on the other hand, they sent us their patients that needed to be seen and wanted to be seen in the VA healthcare system. So we continue those relationships and are just really outreaching to see how we can meet the needs of our veterans as a market, and just get to all your needs that you might have. And I will say though, we're still providing services in the community, but just like everybody else, this is just some of our financial work and the number of consults we're getting. Just like everybody else in 2020 is the gray line. You can see there in April and May, it took a significant dip because we weren't providing those services, or not the services, like a lot of the surgeries were being deferred if they weren't urgent and emergent. But as you can see, we're doing an uptick there, and as we are here with our workload to meet the needs of our veterans. And still, again, trying to provide the care closest to home whenever we can. So I just wanted to take this time to share with you what's new, what's going on with the VA healthcare system here in Ann Arbor. I truly appreciate this opportunity. I wish I could be there with you and have an open dialogue and answer a few questions. But I really appreciate you allowing me to come and present, share with you what's new and what's coming here at the VA Ann Arbor healthcare system, and just the opportunity to provide services to you. I have been in VA healthcare going on about 28 years, and I stay because I love my mission, and I know what my mission is every day, and my mission is to serve veterans, and it allows me to get in there and just kind of improve the whole experience for everyone. So thank you again, and you have a great day.
I know that due to what's going on in the world today, many people are very concerned with how the VA healthcare system's running. And not only that, but what a veteran can expect when he or she goes in, not only in response to COVID, but also just for a normal wellness visit. And so we thank Dr. Kriesman for those updates. They're very helpful. Our next speaker is also a familiar face because she has generously volunteered her time at previous summits to be a speaker. Zanetta Adams is the director of the Michigan Veterans Affairs Agency. She was appointed as director by Governor Gretchen Whitmer in June of 2019. And prior to that time, she actually spent, she's a veteran. She spent 8 years in service as a member of the U.S. Army National Guard, and she was medically discharged with honors. Prior to her appointment as director of the Michigan Veterans Affairs Agency, she was an attorney with Williams Hughes, which is a law firm on the west side of the state in Muskegon, and she assisted veterans with compensation and pension appeals. She has considerable leadership and a very lengthy resume. She has served as a veteran state contact for Senator Debbie Stabenow. She's been an advocate and spokesperson for Challenge America, which is a national nonprofit, and it provides veteran resources. And she's also president and founder of WINC, which is Women Injured in Combat, and that's an advocacy group for women veterans and women active duty members. And she also, in terms of her educational background, she has a bachelor's degree in psychology from Columbia College and a law degree from Western Michigan's Cooley Law School. And today, she's going to be basically giving us an update for the Michigan Veterans Affairs Agency and the work that they're doing to assist veterans in the state of Michigan. And so we'll let Ms. Adams take over.
All right, so, well, thank you for that introduction. My name is Zanetta Adams again, and I am the director of the Michigan Veterans Affairs Agency. Just to give you a little bit of background, our agency was created in 2013, and the premise for our agency was to be stood up to be that central coordinating resource for the state of Michigan veterans and their families. So what that means is that we're here to kind of pull together resources and information from different state departments, agencies, organizations to provide access. And we'll talk a little bit about that as we go through. So just to give you some perspective as to what it looks like, we are the 11th largest population of veterans in the country with a little over 550,000 veterans. Now that doesn't take into account the spouses and dependents that we have to provide services for as well. But we have a rather large population as it goes for states. If you look at this document here, you can see kind of where that veteran population in Michigan is. And if anyone would like to see more of this, I can make sure that the organizers here are provided with a copy of the PowerPoint so that you can look at this to see the numbers and the dynamics and the changes between where we were in 2017 and where we are now. Unfortunately, we've been declining in numbers. But as you'll see on this next slide, there's a reason for that. And so as we talk about the demographics here in Michigan, you'll see that most of our population, we have a huge chunk of our population, over half of our population is made up of those who are 65 and over. So we have an older population of veterans, looking at Vietnam veterans up to a few of our World War II veterans that are left here in the state. And so we really have to focus on making sure that we're not only getting veterans connected to benefits, but that we are providing support for their spouses who sometimes end up being caregivers and their family members as well. So unfortunately, there's some of that decline, and we haven't seen a lot of service members transitioning back to Michigan, and we're working hard on changing that dynamic now through our outreach efforts so that we can have some more veterans moving here and wanting to choose Michigan as their home. So as of right now, it stands at 93% of our veterans are males, and 7% are females, obviously. That number is projected to continue to grow. We have, in the country, we have probably about a 10%, I believe, a 10% number of women veterans that are here, which makes a little bit over 2 million female veterans in the country. That number is projected to grow to about 18% within the next 10 years as more women are joining the military and more women are transitioning out and recognizing themselves as a veteran. And I want to just really confirm and explain that there are a lot of people who don't identify as a veteran because they believe that veterans had to have served in combat. Well, that's not true. By the state definition, if you've served in active duty for basic training and your training school, your AIT or whatever they call it in some of the other branches, I'm Army, so I know a little bit about AIT. But if you've served in that arena, then in any of the arena, and you've passed basic training in your AIT or your specialty school, then for the purposes of Michigan and some of the resources that are available, you're considered a veteran. So that includes National Guard members, that includes reserve members. There are some state definitions or federal definitions, that separate you as to whether you're considered a veteran for the purposes of receiving some federal benefits. And if you're thinking about or wanting to find out more about that, then you can contact us at our 1-800-MISHVET number. And that's that 1-800-642-4838 number, which we'll post at the end of this presentation. But you can contact us to find out if you qualify for any federal benefits, which a lot of people do. So there are a lot of folks out there, including women veterans, who many of you would be considered veterans in the state of Michigan. I would say most, if not all. There's probably a very, very small percentage that we wouldn't consider veterans in the state of Michigan. So hopefully you're identifying as that as well. So what's interesting is when I talked about what we're here to do, we're here to break down barriers. Now, I served in the Army National Guard, Army Reserves for 8 years. And, when I got out of the military, I had difficulty trying to figure out and navigate systems, because a lot of times you see, just like in some other sectors, you see veterans opportunities are living in silos. You might, I live in Muskegon County, and, we have a resource, in the city of Muskegon. But if you don't live in the city of Muskegon, you live in Whitehall or Norton Shores, then you may not understand that those resources are available that could really assist you, but that are available for you as a veteran. And so our job is to take all of this, what you see on I'll just call it a hot mess, what you see on the screen, and turn that into something better, because it can be very frustrating. Let's say you're dealing with PTSD symptoms or issues that surround that, or you're dealing with anxiety, or you're dealing with an injury, or you're dealing with all these different things. You don't want to have to be referred from one place to another, to another, to another. So what our job at the agency is to break down those barriers with our no wrong door approach. So what we want to do, and what we have been doing, is we've been compiling resources. We've been creating partnerships, and we've been engaging with other organizations and departments in order to bring this no wrong door approach to 1-800-MISFIT. So while you can call all those different folks that or that are in your region to find out information, it may be easier to just call us, and we can get you connected to the people in your region, and you don't have to know several different phone numbers. All you need to know is one, and all you need to know is one website. And so if you're looking to get your DD-214, for instance, we have an agreement and a partnership with the National Personnel Records Archive in order to find that DD-214. So if it's here in Michigan or they have access to it, we can pull your DD-214 in a relatively short period of time, a few hours to a few days the most, and get that information to you. Or to, if you're looking for something for a spouse that passed away, we can get that information to you. We can answer questions about whether you're eligible for benefits. We can actually get you connected to a veteran service officer who can assist you with applying for your benefits and getting your service connected compensation and pension, or your aid and attendance for yourself as a spouse, or for the veteran. You can get access to all of those different types of things. We have at our fingertips veteran friendly employers. So if you're looking for a job, one thing I can say is that there are I believe it was over 50,000 jobs available in the state of Michigan, and maybe it was 5,000, but I swear it was like a huge number, like 50,000. But there are jobs available that you could be applying for. There are jobs with our veteran-friendly employers, and if you call us, we can get you connected to one of those people. Also, educational benefits, so we can give you information on whether your credits potentially transfer into credit equivalencies at colleges. So we are here to provide all of that different information. So again, we talked about who is a veteran, and so Title 38 of the Code of Federal Regulations defines a veteran as a person who served in active duty, Naval or the Air Force, and who was discharged or released under conditions other than dishonorable. So if you're other than honorable, or you had a general discharge, you would be potentially considered a veteran under Title 38. And so that's the federal title. And I want to be clear, we're going to talk a little bit about the differences, but we are the state VA. So we can get you connected to benefits, but we are not the deciders of whether you are going to get those benefits. And so the federal VA is comprised of the VHA, which is the Veterans Health Administration, the VBA, which is the Veterans Bureau Administration, and the NCA, which is the National Cemetery Administration. And they all have different jobs that they do, but if you're frustrated with your health care at the VA, or you're frustrated with the process of getting your claims adjudicated at the VBA, you can definitely call us and we can advocate for you, but we are not the decider of that information. So the federal VA is the one who does that. And our vision is that veterans choose Michigan. And as I talked to you about earlier, we have our population is declining in Michigan. So we are responsive to our World War II veterans, our Korean War veterans, our Vietnam War and Cold War veterans. And we are responsive in that we help to get you connected to healthcare. We have 2 state veterans homes with one of them being replaced and another one being built right now to help you in your as you're getting into that time where you need additional assistance in our state veterans homes. And again, we can connect you to that information through our 1-800-MICHVET number. And we also are helping those folks with quality of life. And we're hoping to attract more Gulf War era veterans, post 9/11 veterans, and letting you know that we have educational opportunities. We have employment opportunities. We have things for you and your families to do here in Michigan, and we can get you connected to a lot of those benefits for those veterans. And licensure through the Department of Law, which we can help you and your spouse. Let's just say you were a dental technician in the state of Texas and you want to move to Michigan. Well, there are some pathways to get you into that licensure quicker here in Michigan, but you can call us to find out more about that. And so we talked about employment. So we have over 400 certified veteran-friendly employers. We have 3 different levels of status. We have gold, silver, and bronze levels. And we require different things of those employers in order to make sure that they reach those metrics, whether it's providing hiring events for veterans only, whether it's providing resources for veterans on the job, whether it's going through training on how to retain veterans at their jobs. All those different things are available for those employers so that they can continue to be current on veteran culture. And then we have our Transition Counselor Expos, which we work with Michigan Economic Development Corporation in order to make sure that we are providing answers to help people to transition to Michigan. Some of the other things I talked about, we talked about licensing and credentialing, which includes spouses. We talked about some of those examples, like utilizing military experience toward licensing, even truck drivers. I know we had some 88 Mikes out there who may have had qualifications with the military to drive trucks and are looking maybe to do something like that here in Michigan. Give us a call and we can see how we can get you connected to some of those licensure exemptions or to get you into that pathway quicker. Also with the Department of Education, if you are thinking about going into teaching, they are looking for great teachers, and what better person than someone who served in the military, went through basic training, and knows about discipline to become a teacher here in Michigan. So there are so many different opportunities. It's just one phone call away. We talked about the gold, silver, and bronze level veteran-friendly employer program, but we also have a gold, silver, and bronze level veteran-friendly school program. And that's, we look at all these 7 criteria in order to place them in these categories, and we're looking to see if they have programs for veterans that are in place at their school. So right now, during the pandemic, it's really hard for people to be in person, but that was one of those criteria to see if there were active student veterans organizations or clubs, whether they had a specific link to their website, whether they were doing military credit equivalency and going through those types of training. So we have staff personnel who are constantly working with the universities and schools here in the state of Michigan to make sure that they're providing the best practices and opportunities for veterans to learn and their dependents to get connected. We have 61 veteran-friendly schools in the 2019 and 2020 academic year, and they represent over 11,000 service members and veterans. And they evaluate at least 53 military credit equivalency classes. So that's really important in looking at how you can take what you learned in the military and translate that into some credit, right? Get some money back. So that's really important. Now, we have 4 pillars. We have our employment, we have our education, we have our quality of life, and then we have our health and wellness. So the next one I want to talk about really quickly is our quality of life. And so we have created several different things during this pandemic as everybody's going through a trying time in order to make sure we're staying connected to veterans. And we've been doing that, taking into account that we do have an older population who are not necessarily on social media, but making sure we're reaching them with information so that they can stay connected to us. So one of the things we created during this pandemic was the Check on My Vet, which was designed to help folks, whether you're a family member or you are that veteran. You can fill out an application online. It's a quick application for us to give you a call to do a benefits checkup. But it's also a way that you can hear another voice on the line of someone who understands what you're going through and maybe can help you with financial assistance, can help you get connected to all different sorts of things. We've done several virtual coffee hours on a different array of topics to make sure that you are current on the information that's being provided, not only during the pandemic, but on information and that's relevant to you, whether it be tribal veterans out there who are looking to have resources and connection, whether it's caregivers who are looking to find out, are there benefits and opportunities for me to get payments or to get mental health resources for me, whether that be, we just had a mental health resources virtual coffee hour. Whatever you need, we're there. One of the other things we look at, which is really great that we're on this call with Legal Help for Veterans, is our veteran justice. So we have 27 veteran treatment courts, and we also were very integral in creating the Veteran Treatment Court Manual in partnership with Cooley Law School in order to make sure that we're providing best practices. So if you are looking to find out more information, we just had Justice Clement on one of our radio shows, I believe it was like last week, and she talked about, she gave this plea out to those who are going through the justice system in any capacity. If you're going through that justice system, let them know that you're a veteran, and there may be a pathway or some additional assistance available for you in that court. Veteran treatment courts are not in all the court systems, but they are in many court systems, and they're continuing to grow. But let them know that you served, because that's going to be important in seeing how we can get you connected to additional benefits. We talked about the veterans' homes. We have the Grand Rapids Home for Veterans and Jacob Betty, which is up in the UP in Marquette. And then we also are building one in Macomb County right now. And so that should be done, looks like early next year. One of the other things that's really important, no matter if you're going through the justice system or not, is our emergency assistance that we have right now. So we have the Michigan Veterans Trust Fund, which is for wartime era veterans. If you're not sure if you're a wartime era veteran, give us a call and you need some assistance. We will take your cases on an emergent need, and there is no necessarily a cap to how much we can pay, but we look at what's emergent and we try to help you with that. So if you're struggling right now, you're dealing with something, maybe you're a victim of some of the flooding, maybe you're having some issues, your lights are about to be cut off because you haven't been able to pay them because you lost your job because of COVID. Whatever the case is, if you qualify, we can assist you with that. We also have a County Veteran Service Fund grant, which, at the end of September, those funds will be done for this year. But if you can contact your county, and that's another avenue, whether you're a wartime era veteran or not, that you can get assistance, you can get access to Meijer food vouchers, you can get the help you need. And so we want you to know that we're here for you. And if you're uncertain as to whether you qualify or not, just call and ask. It's not going to hurt you to call. We're not going to be upset if you don't qualify and you called. We want you to reach out to us to find out what's available to you. And as we talked about earlier, there are some differences with federal VA benefits versus state VA benefits. So we have 38 facilities here in Michigan. When I say we, I mean the state of Michigan. This is where they're at. But the federal VA has 38 facilities here in Michigan. 5 of them are the larger VA medical centers. And then we have 18 CBOCs, which are our community-based outreach clinics, 8 outpatient clinics, which are VA, and 8 vet centers, which help with mental health and wellness. And those are, the vet centers are no cost as well. And then we also have Fort Custer is a national cemetery that we have, and then the historic Mackinac Cemetery. So those are some of the things that we have. federal VA, which is through the Veterans Benefits Administration in Detroit. They process compensation and pension claims. They assist with, those are funds that go directly to the veteran. So if you're a veteran who has low income and you served in the military, but you don't have a service-connected disability, you could actually qualify for pension. You're over a certain age, or your spouse. So if you're unsure, again, give us a call at that 1-800-MISHVET number. They also help out with the GI Bill. They help with Voc Rehab, which is their veteran readiness and employment programs to get you either, to basically get you employed. So if you're a veteran who's struggling and you have, I believe it's still at least a 10% rating, then you may be able to get assistance through the Veterans Benefit Administration. And they also have folks enrolled in healthcare. I would say then, how can you get connected to benefits? So it's really important that we emphasize that we have 138 accredited counselors in 73 counties, and we have 60 accredited veteran service officers within the Michigan Veteran Coalition. And we have 5 that we service as well, that we offer as well through our agency. So if you called us, you would get connected to one of those over 200 veteran service officers in the state. You would get connected to one of those folks who could help you get your claim. And so we really are focusing on trying to increase the training that these folks receive so that they can continue to provide the quality service that veterans and their spouses and caregivers need in the state of Michigan. So give us a call and we can get you connected to that. One of the other ways we're connecting veterans with benefits is through our VCATs. And so that's our Veteran Community Action Teams. And through that Veteran Community Action Team, we have 10 of them across the entire state. So we have 10 prosperity regions that was set up during the last governor's administration, and we have one in each region. And VCATs, what they do is they bring together nonprofits to actually help veterans in that region. So each region knows what's specific in their region to help veterans, and they know what's important in that region. And one region is not going to be the same as another. The UP is going to be different than the region that services Detroit. So we want to make sure that if you're an organization or you're a service provider, that you get connected to the VCAT in your region so that you start to learn what's out there for veterans, so that when you service those veterans within your organization or company, then you know what's available. Another way that we're trying to reach veterans is through our CORE initiative, which is our community outreach and regional engagement. That's a relatively new program, and it's comprised of several different components, whether it's senior veteran community engagement officers, our buddy-to-buddy volunteer mentorship initiative, which is our volunteers, our speakers bureau, which goes out and speaks to different folks and organizations and places like this, and even schools, to educate them on veterans benefits that are available, but also pride in the military. And we do this, and we also work with MDHHS, which has veteran navigators, and they help with the mental health and substance abuse piece of the puzzle in order to pull together this comprehensive team of people that are working within your communities. And we have 10 of those core groups throughout the state in each of those regions as well. So you'll see more of that soon. Finally, you can connect to us through our Michigan Veterans Resource Service Center, which is that 1-800-MISHVET number I've been talking about. That's that 1-800-642-4838. Or you can reach us at michiganveterans.com, and that's 24/7 access. So our actual technicians are there from 8 to 5 Monday through Friday, but then it transitions over to 211 operators. So if you called at midnight, you'd be able to reach someone, and they can get you connected to some resources, or send us an email if it's something that you need to get service provision following that. So know that there's always going to be a voice on the line if you need to call. And so if you have any questions, you feel free to reach us. You can give us a call at 1-800-MISHVET, or you can go online at michiganveterans.com, fill out Check on My Vet, or you can send an email to our link that's there. Thank you so much for having me today. I hope that I provided you with it was very high level information, but I hope I was able to provide you with some information that you will find useful.
For over 65 years, Community Financial Credit Union has been here for you. And together, we'll make it through these uncertain times. Now more than ever, we're committed to keeping banking easier and safer. If you're struggling through financial hardship, we can help. Bank on us when times get tough, because that's what community is for.
We're making banking easier. Community Financial.
With the blink of an eye, your life is on hold. You just got into a car accident. Here at the Jack Dummer Body Shop, we have the professionals you can trust and the experience to fix all of your vehicle's needs. Trust the professionals at the Jack Dummer Ford Body Shop Center to get your vehicle back on the road safe. We offer towing, detailing, free estimates, insurance company assistance, and paintless dent repair. It's time you become part of the Dummer family.
All right, well, we thank Ms. Adams for being with us today and speaking. I think it's very important not only for all of our veterans to be aware of the federal benefits that are available, but also what the state government offers to them. I know our clients at Legal Help for Veterans ask me all the time what local benefits are available to them. And so it's really important to learn about the benefits and resources that the state government offers. So hopefully that was beneficial for everyone listening in. I would like to remind everybody that we're going to be sending out an email after this to all of our attendees. You will get copies of all of the presentations and everything. So if you're not writing as fast as you hope you would, you will get copies of it. And so you can listen to it again and view the slides and get all of that important information down. Also, just a reminder, there's the chat function at the bottom. If there are any questions during any of these presentations, feel free to send a chat. I will be checking it, and once we go for our live Q&A, we will have our panelists be able to answer those questions. I'll present it to our different panelists who have knowledge to be able to answer those questions. And so with that, our next speaker is Ann Zerbe. Ms. Zerbe was appointed by Governor Whitmore to be the executive director of the Michigan Veterans Facility Authority, which is the governing board for the Michigan Veterans Home. She's been in that position since September of 2019, and she is involved in the oversight and future operations of all the new state veterans homes, as well as directing the day-to-day duties of the MVFA staff. Prior to joining the MVFA, she was Vice President of Business Affairs for the Michigan Veterans Health System, and she oversaw the business offices of Michigan's two state veterans skilled nursing facilities. In terms of education, she has a multitude of degrees. She actually has a Bachelor of Arts in English and American Culture from the University of Michigan. She has a Juris Doctor from the University of Florida, and she also has a Master of Public Policy from the University of Michigan. And so now we'll let Ms. Zerbe talk to you about Michigan Veterans Homes.
Thanks so much, Jim, for having me today. My name is Ann Zerbe. I'm from the Michigan Veteran Homes. Just here to provide a little overview of what we do. So thanks so much for having me. First of all, we'll talk a little bit about VA-covered long-term care, the State Veteran Home Program, Michigan Veteran Homes, a background about what we do, and some recent developments that we've had at the Michigan Veteran Homes, just to provide your audience with a little bit of details about what we're working on right now. So first of all, I just wanted to provide a little bit of an overview of what kinds of care the VA covers in terms of long-term care. There is a spectrum of care when you're looking at long-term care that many people are familiar with. It goes all the way from independent living to skilled nursing care that someone might need. The veteran homes across the entire nation provide certain types of care, but not all types of care. Some other types are provided by the VA. So for example, assisted living has some availability for eligible veterans. Home care is available to some veterans who are enrolled in VA healthcare. Adult day health care is also available. And long-term care is sort of where we focus. It's available to all of the veterans that live in our state veteran homes. And it's available to priority status veterans in other settings that the VA addresses. Skilled nursing. Community living centers are one of the areas in which veterans can receive long-term care. They are typically located within a VA medical facility, and there are a limited number of beds. Community nursing homes are also available to veterans to receive skilled nursing care. Those are going to be private or nonprofit nursing homes that have a contract with the VA, and those homes will provide a certain number of beds to veterans. We are the last kind of tier in that skilled nursing facility provision. State veteran homes are long-term care facilities that are owned and operated by the states in partnership with the VA. And we are able to provide care to all eligible veterans regardless of the priority status within the VA system. So a little bit of background on the State Veterans Home Program more generally. A lot of times people get state veteran homes and the VA confused. We are not part of the VA system. We are instead a part of a partnership with the VA. We are regulated by both federal and state laws, but we are owned and operated by the state. So it's not going to be, although we operate in conjunction with some of the VA medical centers, a lot of our residents go to appointments there. We are not part of the VA, the federal VA system. So the state owns the building and the land. The program oversight, so our surveys and things of that nature, are performed by the USDVA and their contractors. We have annual quality of care surveys that are performed by them, and we are then recognized and licensed to act as a state veteran home by the VA. State veteran homes actually represent one of the largest systems of long-term care providers in the United States. Every single state in the United States has one, including Puerto Rico. We have over 30,000 beds for veterans and dependents that need skilled nursing care, domiciliary care, which we'll talk a little bit about, and adult day health care. So you can kind of see where all these veteran homes are all over the country. And it provides a tremendous number of beds, a tremendous amount of support, and just helps support the VA in providing that skilled nursing and other long-term care services to veterans that the VA is unable to provide in some of their medical centers. So skilled nursing care is going to be accommodations for individuals who are not acutely ill and not in need of hospital care. This is going to be what you think of as skilled nursing care, nursing homes, that type of care where someone's going to be staying either short or long term that needs that support in a residential setting. Domiciliary care is treated a little differently depending on the state that you're in, but it's going to be something less than skilled nursing care. Sometimes it's treated more like assisted living, it can be somewhere between independent and assisted, usually assisted living. And sometimes it is more a housing support program. So it really depends on the state. And we have a mixture of individuals who have participated in our domiciliary program in Michigan. Adult day healthcare is not something that we currently provide in Michigan, although we are looking into it, and it is our hope that we'll be able to provide that at some of our facilities moving forward. That would be where the veteran does live at home, either with family or someone else, but receives care during the day, maybe while their caretaker is at work, something of that nature. So recent developments and trends. So the VA has been continuing to increase its support of state veteran homes in large part because we really help support their capacity. You can kind of see on the chart, the number of homes has gone up steadily since 2000. It's actually even higher than this at this point. We actually, and we'll talk about it a little bit later in the presentation, have 2 new facilities under construction currently that are going to be providing these services to veterans in Michigan and their dependents. So you can kind of see the VA has really put a focus on increasing their support of this program and increasing the number of veteran homes across the country. So how exactly does this work? State veteran homes are eligible as part of that state-federal partnership to receive a per diem reimbursement that the VA pays, and it goes directly towards the cost of care of the individual, the veteran living in the state veteran home. So this is usually divided up based on what your service-connected disability rating is. And that's going to dictate how much the VA contributes towards that cost of care. So a veteran with a combined service-connected disability rating of 70% or more is going to be fully covered by the VA. That means when they come to the state veteran home, they do not pay anything out of pocket. And unlike some other options in the private sector where you would be required to spend money in order to receive care for free, spend down your assets, things of that nature, this does not, that has nothing to do with it. Simply the fact that you're 70 to 100% service connected is going to make you eligible to receive completely covered care, free care at one of our facilities. All other veterans are going to be partially covered by the VA, and we'll talk a little bit about those rates a little bit later on in the presentation. A little background about the Michigan Veteran Homes more generally. We have gone through a few changes in the last couple of years in terms of our organization, but essentially what our mission is just to provide nation-leading long-term care and services to the veterans that we serve in our facilities. We really want to continue to see improvements in our facilities and be one of the nation-leading providers. And I think we're moving in the right direction with the construction of some of the new facilities that we're building. And just very excited about some of those. And again, we'll touch on some of that as we move along. Grand Rapids, as background, we have two facilities currently, one in Grand Rapids and one in Marquette. The Grand Rapids home has been open since 1886. It's on quite a large campus with 3 main buildings and a large veteran cemetery that is also part of that campus. We're in the middle of a decrease in our census at that facility in preparation for opening our new building. So we have about 180 skilled nursing beds currently and around 20 domiciliary beds available. Jacob Eddy, located in Marquette, is in an older building that used to be a hospital and was first opened as a state veteran home in the early 80s. So we do have about 184 beds available at that location for veterans in need of skilled nursing, as well as some eligible dependents. In order to be eligible for care, a veteran must be deemed eligible for VA health care for long-term VA health care or financial assistance for long-term nursing or daycare. We, subject to space requirements, do allow eligible dependents to live in our facilities. And a question a lot of times we had asked, is Michigan residency a requirement? You're not required to be a Michigan resident at the time of your application. So we have some folks who have lived in other states for a while, want to move back to Michigan to be closer to their family, and choose to live in one of our facilities at that time. So that's something that's definitely an option. The member cost of care is going to be based on the member's ability to pay. We do a monthly assessment that determines that. So it can range anywhere from 0 to the full cost of care. We're going to consider assets, income, many of the same things that would be considered when someone is receiving care in a typical nursing home in the private sector. So residents that are unable to pay the maximum amounts are assessed on that sliding scale. Here is a breakdown of the exact costs for admission into the home and the monthly fees. So a 70-100% veteran, as we've talked about earlier, is fully covered by the VA. There would be no out-of-pocket costs associated with that. All other veterans, the current charge is $170.64 a day. And we'll talk a little bit more of what that equals out to on the next slide. Non-veterans also eligible to come to the facility and live are at $283 a day, and that's going to be for skilled nursing care. Domiciliary rates are also listed here. There's relatively limited number of beds, and that tends not to be what most people are most interested in when we have these presentations. So I'm going to kind of focus on the skilled nursing aspect. And this, you're looking at it on paper. What does that mean in terms of comparing when you're getting skilled nursing care out at some other nursing home in the community? Well, right now, you can kind of see on this slide what the benefit is to veterans coming and living in our facility from a financial perspective, which is right now for skilled nursing care, the average cost in Michigan is about $8,300 to upwards of $9,000 a month for different types of rooms, semi-private or private. And that's going to be over $100,000 annually to receive skilled nursing care. In the veteran homes, it's either going to be, no cost because you're 70 to 100%, or it can range anywhere, again, on a sliding scale from $0 to $62,000 annually. When you kind of spread it out over the year, you can see what a huge advantage this can be in terms of not having to spend quite so much on the skilled nursing care that an individual might need. So some of the recent developments we've had in the Michigan veteran homes, starting in 2016, we had a work group that was formed, included industry professionals, healthcare specifically, veteran advocates, and legislators to develop some recommendations about how we wanted to improve our system going forward. They shared its report, in a number of legislative initiatives and other things were developed as a result of that, which resulted in some funding and some legislative and statutory changes. The recommendations included the development of an authority-based governance model. We're not going to get too much into that because it's a little bit in the weeds, but it has a lot to do with the flexibility and adding some people to the board who had healthcare experience. It also recommended the new construction and operation of some smaller facilities. Right now, we have very large, much more institutional facilities. They look a lot more like a traditional hospital. Now we are talking a bit more about facilities that look more like home-like environments. And the recommendation was to spread those smaller facilities out in population centers across Michigan so that more people would have access. You can see on this slide that we used to run in Grand Rapids a facility with over 600 beds. That is a very, very large skilled nursing facility. So now this is a little outdated. We are actually down to 180 instead of 320. We're running a smaller facility. And this is, you can kind of see when you look at this map, there's very little access in certain areas of the state to receive this skilled nursing care unless you want to drive to Marquette or Grand Rapids. So the discussion was, how do we use these 964 beds that we're currently eligible for to spread that out across the state? And so we asked the VA to do a bed replacement project where we would look at different population centers and spread those eligible beds out from just those 2 locations to be spread out across the state. It's a multi-phase plan, and we want the model of it to be replicable, where we can, once we build one, we have something else that looks similar that we can use those plans to design and build other facilities in different locations. They'd be designed to better align with a lot of current industry standards, which is going to be less hospital-like, more home-like. And we'll talk a little bit more about that as we move through this. We'd also recommended the geographic distribution, which we talked a lot about. And we wanted to build something that is much more desirable for people to live in moving forward. We know that today's veterans don't want to necessarily live in a room with 2-3 other people, which was how the design of the original Grand Rapids building was. Sometimes we had rooms where four veterans were living together in a room. People just don't want that today. So we wanted to look at how do we provide semi-private or private rooms to all of our residents. So right now we are in phase 1 of our replacement project, where we are replacing the Grand Rapids facility with a smaller facility. And again, these numbers are slightly outdated based on our new design. We are actually going to have 128 beds in each of those facilities. And the location has been decided. It's actually in Macomb County in Chesterfield Township. So a lot of this has happened in the last year, where we received federal funding, we started construction, and we are scheduled to complete a lot of that construction in 2021. So a big part of this is the small house design, which is going to be about creating a home-like environment. That is one of the main goals of this design. We talk a little bit here. It's a design that's recommended by the VA. They've really encouraged it as part of this grant program that has helped fund our construction of these facilities. So what the basic concept would be is you have a community center surrounded by smaller home-like units that are separate. They're like a household, instead of more like a hospital wing, which is what you tend to see in older designs of skilled nursing facilities. This just gives you a little idea of what you would want it to look like. The community center is going to be that hub for all of the households that surround it, where you're going to have your multi-purpose room and your bistro and things of that nature. It really feels sort of like the town center with the neighborhood surrounding it. It's intended to create a sense of family among residents and staff and provide opportunities for more engagement in small groups, in a sense of, this is really my home, this is my residence. It doesn't feel so institutional. It feels much more like a place that you want to go live. So these are some of the architectural impressions we have of the design that's currently underway. You're going to kind of see this would be an example of a household where you have access to the outdoors. This is really going to help. I mean, this isn't part of the presentation, but in light of everything that's going on with COVID-19 right now, we know that having this single story design is going to help us facilitate keeping up a lot of social interaction, getting outdoors for our members when you do have some type of infection control crisis like the one that we're facing right now. This is a kind of example of the indoor architectural impression of an area that would be the dining and living room space out in one of our neighborhoods. So this is where people live. As you can see, much more home-like design. And this is an example of a resident room. All the resident rooms in the new facilities are going to be private rooms. So we will not have any more shared rooms in the new facilities that we're building. A lot more space, a lot more opportunity for natural light. Those kinds of things are really important in this type of setting. So if you do have any desire to contact the homes, this is some contact information for you to be able to do so if you want to inquire about admissions or any of the other things that we're working on at the homes. But this was just to provide you with a high-level overview of what we're doing, what we have been doing, what we are doing now to move forward. And I really appreciate everyone providing me with the time today to present and give you a little more information about what we're doing at the Michigan Veteran Homes. Thanks so much.
All right. Well, thanks to Ms. Zerby for providing us with that update on the Michigan Veterans Home. We got one question via chat. We'll get that answered during our live Q&A, which is coming up in 2 more sessions. If there's anybody else who has any more questions, feel free to use the chat function. It can be on any topics whatsoever. We have a variety of experts, and also our next speaker, Jeff Hall, he is going to be on the live Q&A as well. So if you have any questions regarding his presentation that's going to be coming up, feel free to use the chat function and we'll be able to have him answer it for you. And with that, I've already kind of let the cat out of the bag, but our next speaker is Jeff Hall. He is the National Employment Director for the more than 1 million member disabled American veterans. He's been in that position since March of 2014. And in that position, he oversees special employment initiatives that the DAV has. He also works with private and public entities to develop and build partnerships to address joblessness and underemployment. He facilitates job fairs, and he also leads efforts to connect veterans and employers together. I did not memorize his resume, so I'm going to need to read it because this man has more experience than I ever hoped for in my life. But he started off as a National Service Officer in 1993. He moved up to be a National Appeals Officer with the Board of Veterans Appeals while at DAV. Then he was the Assistant Supervisor of the Louisville, Kentucky office and was the Supervisor of the Chicago, Illinois DAV National Service Office. And then he was simultaneously promoted to be supervisor of the New York National Service Office at the DAV and the National Area Supervisor of Area 10. And then finally, he was the Assistant National Legislative Director in 2010, and he was telling me earlier that he testified before Congress. So that's a horrible job. I can't imagine needing to do that. And then he was finally promoted into his current position. And so with that, I will let Jeff take over and discuss jobs and veteran employment.
Well, thank you, Jim, for that kind introduction. I'm Jeff Hall, and I'm the National Employment Director for DAV, Disabled American Veterans, and I work at our national headquarters in Cold Spring, Kentucky. As the National Employment Director for DAV, I have the privilege of our startup with the program back in 2014 to where we are today. And so I'd like to walk you guys through where we were and where we've come along the way in the many aspects that we have with our national employment program. Again, as I mentioned, for me personally, I'm a U.S. Army veteran. I was combat wounded during the first Gulf War. After I came home, I had a lot of options in front of me, but when DAV, approached me about coming to work as a national service officer, I really loved the idea of helping other veterans, especially disabled veterans, receive their VA benefits. I had had my own problems with my own VA claim, so it really interested me that there was a necessary component that veterans needed to help. Where I was under the impression, like many, that a lot of things are just simply automatic. I was truly thankful that DAV had reached out to me in that aspect, helped me through the process. And then I, of course, joined their professional staff in 1993 in Chicago. I'm an Indiana native, so being in the Midwest was where I wanted to be. But it didn't take long after that. I left the Chicago office and worked at our Board of Veterans Appeals office. Then worked my way up through the Louisville, Kentucky office back to Chicago. Then I ended up in Manhattan as an area supervisor for DAV. I worked there for several years before I moved on to my next assignment, which was joining our legislative staff in Washington, D.C., working on Capitol Hill with either policymakers at different levels of government, different areas of government, and of course our elected officials, whether we were working on bettering the benefits or the claims process that was so much more problematic at that particular point. So there was a lot of headway has been made. Of course, nothing that I'm sharing with you is problem-free. If it was problem-free, there would be no need for organizations like DAV. And from a historical aspect, Judge Robert Marks, who's a World War I veteran, he was born clear back in 1889 here in Cincinnati. And he was the one after World War I knew that there was a need for care and concern for veterans who were injured traumatically, some so severely that they, with a whole host of different types of disabilities. And Judge Robert Marks was the founding member of the DAV of the World War. So it was DAV-WW back in the beginning, and it was founded here in Cincinnati. But we aren't without Michigan roots, because along the way, Mr. Marks had made his way to Detroit and was a successful public servant in way of he was a lawyer. He, obviously became a judge and all of those things in between, but he resided for a great amount of his career there in Detroit. Fought against Henry Ford to a degree because of, auto accidents and things like that he was working on. But later that came around because DAV has been a partner of Ford Motor Company since 1920. We've done so much with Ford Motor Company. They've done so much with us. Whether, primarily in supporting our DAV van transportation program to transport sick and disabled veterans to and from their much needed VA medical appointments, wherein they may not have any opportunity to get or means to get to and from their medical appointments. So we have a long lineage and history with Ford Motor Company, of course, Detroit/Michigan. So it's a pleasure to be here to talk not only about a little bit about DAV in our overall sense, but obviously the programs and services that we provide with our newest program, which is our National Employment Program. We're a very small staff. We're one of the smallest within DAV. There's myself, my Assistant Director, Rob Luigi, our National Employment Specialist, Mary Hunter, and then one that pulls it all together for all of us is Jordan Heck. And we do so many different things that I'm going to take you through into this process of probably not too far and deep, but to give you a really good view of walking in and starting the program from scratch to where we are. As you might surmise, I mean, we represent veterans' interests in the employment sector with all branches of the government, whether it's the DOD, the DOL. We work with Disabled Veteran Outreach Program Specialists, local veteran employment representative, Small Business Administration, of course, the Department of Veterans Affairs, specifically vocational rehabilitation, and a lot of people at the state and local level. We are a national program, but we, as you probably know, we have many, many great volunteers and members of DAV throughout the country. We're about 1 million strong as far as our membership base goes. And so many of these folks out there, we can't do it without our volunteer corps. Again, whether it's in Michigan or whether it's in Ohio or Kentucky or all of the other states and including Puerto Rico, our volunteers make it work, and our employment program would be no exception to being able to provide the services that we do through this program without, certainly our volunteers. To get into it a little bit, we have several different ways that we provide our employment services. And what I like to tell people is kind of when you're setting up a program, it's the pillars that you want to build around. And so while we've come a long way in that regard, the 3 pillars still remain the anchors of the program, and that is how we provide our services. And that is either through direct engagement with veterans and employers, to certainly our online tools and resources, and our career fairs that we bring together and do those across the country. Of course, I'm going to talk about that a little bit more because of how COVID has affected that, but what we've done in reply to that to continue our services. But our main website for the employment, we're the only program within DAV that has a standalone website at jobs.dav.org. So everything I talk to you about here in this presentation, you can find there on our website. And this is something that's constantly evolving, as you guys probably realize how technology and especially the internet or web-based applications work. It just constantly changes. Something new and improved comes out. There's a better way to do it. The appearance isn't working. Whatever it is, any variety of those things. What you're seeing on these slides that I have here is probably the 12th iteration of our website. But we're very happy with where we are right now, but we're constantly looking at ways to improve that. This is now, we just rolled out here earlier this year, really around the beginning of the year and pre-COVID, the website that you see now, but we've already made some changes that you'll see. We've added more tools and resources for veterans, and we get about right under 10,000 people that visit us every month. And they are exposed to, whether it's veterans or employers alike. And that is one thing I'd like to say right up front is, when you're working with an organization like DAV and your focus is on the advocacy and the service directly to the veteran or the family member, in this setting this particular program up, the whole thing was providing that direct service, helping a veteran secure meaningful employment. And that's the root mission, whether it's the spouse or anybody attached to that individual as a dependent. But we had to look in a broader range when it came to employment. Yeah, that's true. There's about 200,000 people that leave the military every year, give or take. DAV has a transition service officer program where we have those individuals located on military bases. I think we cover about 100 military bases and are involved in the separation process. So being there and being involved, employment has to be right up front, because that is one of the key things that for individuals as they're leaving the military service. Yes, they want to make sure that their finances are in order, but when you ask them in an overwhelming response, those individuals, first and foremost, they want to know what's going to happen with their livelihood. They're leaving a career, they're going into a new career. And so employment assistance has to be right there, right up front. And our transition service officers certainly make them aware of what DAV has to offer. Even if it's particularly guiding them to our website so that they can see these tools and resources. Our job board that has, it's actually increased from where I have the figures here on this slide, which is pretty recent. But we have around 200,000 active opportunities on the website. How individuals search for those job opportunities on the website is pretty simple. Type in the keyword of what job or career path you're looking for and what location. And what we always tell people is certainly to be creative with what you're putting in there. If you want to put in there supply chain, the only way you're going to find supply chains in that, supply chain jobs in that, is if the company that's putting the job posting in there uses that phrase supply chain. The supply chain can be tied up as logistics or any host of those things. So what we encourage people to do is certainly just be creative when using the job board, and you can apply directly for those jobs from there. We have other things here, specific links to companies that we work directly with, such as Herc Rentals, Cintas, Fiserv, and a host of other ones, Ford Motor Company, and so on and so forth, that we want to guide people to those. And when you click on any one of those, it'll take you to whatever that company has. Could be a military affinity page where it tells people, I want to come to work for you. What do you do for military veterans? Or do you even recognize them? Or is it just you kind of come in anonymous? Some people want to be anonymous, and we understand that. We encourage them not to be, because there are so many advantages of letting a company know that you're a veteran, that you're a disabled veteran. Companies benefit greatly from things like work opportunity tax credit and other tax incentives for hiring disabled veterans. So we've come a long way in that particular category. But there's a lot of road in front of us, and hopefully our online tools and resources that include videos, and we have in progress a resume writing. We have tips on there right now, but we're putting the finishing touches on being able to provide a no-cost certified resume writing opportunity for veterans, where we would, when we roll that program out, hopefully before the end of this year, when we get everything worked out, veterans would be able to come to this website, find a resume. You need a resume, and you click on it. It's going to connect you directly. You're going to have to fill out some information. It's going to first verify if you're a veteran through ID.me or something similar. And then when you get plugged in, you're going to be plugged into a certified resume writer that can write your resume, whether it be for in the traditional career path or if you're looking for federal employment, which is a much different type resume. So that's going to be forthcoming. And as I mentioned, one of the most underrated things I personally encountered was when you're providing service and you're used to providing service directly to the veteran, I never really accounted for the employer in this situation. When in fact, what I learned very quickly, within the first few months and really within the first year, kind of looking back on that road, was simply how much interaction was taking place with companies that were reaching out to us, companies that, we were working with. But we had to have an employer section, on our website so that employers that were coming to us would also find valuable information. One of those things we started out right away with was doing a lot of research and coming out with our publication DAV Guide to Hiring and Retaining Veterans with Disabilities. And why that came about was it really was born out of so many questions from so many companies that were coming to us asking the simple or elementary question. We want to hire veterans. We want to hire more veterans. We want to hire veterans with disabilities, but that's a slippery slope and we just don't know where to begin. From something like that to, even more and then, into the weeds with things like, we want to hire veterans. We certainly value them. We're patriotic. We recognize their services, but when we look at their military paperwork and if we see anything where they have combat, they're probably somebody that has post-traumatic stress disorder, and that's just an area that, frankly, we're fearful of, that we don't want to have a workplace incident. So I share that with you simply to probably something many of you already know, if not all, and that is, PTSD is not a military-related disability. Many companies, and that's usually how I replied to companies, was how many employees do you have that aren't veterans that have post-traumatic stress disorder? And of course they couldn't answer that. And you simply tell them, you would be shocked to know that you have more people who didn't serve in the military that have post-traumatic stress disorder. So it's just something that's been stigmatized throughout the years through the different media outlets and whatnot. And so we wanted to have a guide that helped, a practical solutions guide that would offer some very elementary to a little bit more deep in the weeds type information for companies that were struggling with that particular challenge of hiring and retaining veterans with disabilities. So that guide is available on our employers section, as well as some other tools and things like that they can use. We want to recognize companies for their outstanding support of veterans in way of recruiting, hiring, retaining veterans, recognizing their veteran employees. And there's so many great companies out there that do a fantastic job with it that they need to be recognized. And there, again, the list goes on, but we have an outstanding employer of the year where we recognize a small, mid-sized, and large employer of the year every year. We like to bring them to or invite them to come to our convention, our national convention, and accept their award on stage. It's something to let them know that in the arena of veterans with disabilities, DAV is the powerhouse and the leader as the voice of disabled veterans. And so to be recognized as someone that we recognize as a huge, supporter of disabled veterans and their families is really something they should look at. We've made that a little bit easier process. I have a couple slides that talk about it. It was a paper application process, and we worked pretty hard here at the end of 19 to do an online submission form. So a company, an employee of a company, it doesn't have to be the top person in the company. It can be anybody. It can be somebody in the community that just simply recognizes this company is outstanding for what they do for veterans. They always support the Veterans Day Parade or Memorial Day activities, any number of things. So anybody can do this. Anybody can go online, click on this employer recognition tab, and it'll take you to an online submission form that simply you fill it out. There's a couple of things we ask you to upload and attach. And at the end, when you click submit, it comes right into our employment inbox, i.e. me, as well as my team, and we review all of those. We make the selection once a year. We're kind of looking at maybe doing it more often, but that's some things coming down the road. But this is live. This is out there. So if you or someone you know, a company you know is worthy, or you feel they're worthy, we certainly invite you to submit a nomination for Outstanding Employer of the Year. Again, as I mentioned, the hiring guide, it is a practical solutions guide. It's there. It can be, the PDF is available. It can easily be downloaded. If you'd like to request hard copies, all you have to do, and my contact information will be at the end of this presentation, simply shoot us an email and let us know if you'd like some hard copies, and we'll be happy to send those out. Our job fair section under that tab, as you might surmise, is our full job fair schedule. I have a separate section of this presentation that talks about where we are with our job fairs, but when you click on it, it takes you, that tab, it will take you to this section, and the ongoing schedule scrolls. It's automatic. So once the event happens, it comes off of there. We actually have 2 events today. And when those are done, it automatically slides up. There's some slider there to the right. It's stationary on this slide as fixed on our partner, Recruit Military, who handles the logistics of all of the career fairs. They're a great partner. We've started this program with them, meaning when we rolled out our employment program, they were there as a partner, because one of those tools that we wanted to have were certainly our career fairs. And they, after I went to several different types, they were the industry leader, in my opinion, of the quality of the amount and quality of the exhibitors that were there, but also the number and the variety of different levels of candidates that were coming through the door, whether you were, enlistment, you got out as an E4, or you were, an 06 or higher. It doesn't matter. There's something for everybody at the career fairs, and we do a lot of them. The full schedule can be found by simply clicking on the green tab at the bottom of that. That we update regularly. All of them are hyperlinked, so when you click on it, whether it's on the page here or on the schedule, when you click on it, it will take you automatically to the registration page, and individuals can it's very easy to register at that particular point. Speaking of our job fairs, we've had to do a huge pivot, as a lot of companies had to do a pivot in many ways due to the COVID-19 virus. I'm going to talk about that, but since 2014, as I mentioned, our partnership with Recruit Military has been going strong. Again, they are the leading, organization as far as in our opinion, the quality of events that they produce. For us, we were engaged with doing 125 physical job fairs per year. You saw our staff at the beginning. There's really only 2 of us that do the traveling, myself and Rob. We do rely on some of our local people, whether it be national service officers or department service officers, or even transition service officers, if it's a base type event that makes sense that they're there. So we cover 125 events, pure and simple. And then we also do 15 virtual events with Recruit Military as well. Again, a lot of those things changed this year in a huge way, especially for us when we were used to traveling every week, Rob and I, every week, traveling someplace by plane to go to, whether it was Miami or Seattle or San Diego or Boston, or, those are the 4 corners, kind of all points in between. Our biggest job fairs are physical job fairs are places like Dallas, Atlanta, Houston. Those events are extremely large. One of our toughest markets for career fairs is California, with the exception of San Diego. It's very tough. We do a couple times a year. We're in Detroit. And of course, this year we had to pivot because of the COVID-19. I think we had 15 job fairs that we had attended, and roughly 8 or so that we had not attended, for about 23 events that we had in the book when Recruit Military sat down with us, and they were like, hey, we got to start moving some of these because venues started canceling due to the virus and restrictions. And of course, we learned a lot along the way. It was a slow process to pivot and convert job fairs from physical to a virtual event, but Recruit Military did an outstanding job in doing that. Obviously, everyone wanted to try to avoid, canceling everything for the year, but that's eventually where it led. In this particular case, I don't like to use the word cancel because we had an alternative, and that alternative was online or virtual career fairs. So with Recruit Military, it was a pivot to going from a face-to-face job fair to a virtual event. And we've done certainly a number of those. We have a whole host of those left on the books for the year. We do them city-specific. We did combination job fairs where we were doing standalone events in Cincinnati, Pittsburgh, and Detroit. And we did a combination job fair virtually that was for veterans who reside in really this huge area of Detroit, Cincinnati, Pittsburgh. So one event for all of those combined. It made better sense to do that in certain locations. Dallas is a standalone event. Then we also have base-specific events like Joint Base Lewis McChord, Camp Pendleton, certainly Fort Bragg, Fort Hood, any number of them. We do quite a few of those. But our biggest ones are attendance-wise, both from companies and veterans alike, are our regional events. And so those are denoted as, you know, when you click on it, it'll say Eastern Region or Mid-Atlantic or Central Region, so on and so forth. And then we also do those that are much larger, a nationwide event. Some companies love that because they just have that kind of a footprint where they want to recruit for all corners of the United States. And so those benefit those companies perhaps in a greater way. Those, we get about 100 employers, or about 80 right now, 80 companies that come to the nationwide event as an example. And the last one we did, the last two we did, one was about just shy of 1,700 veterans that attended, and the other one was a little higher with 1,988 that had attended. It's a huge audience for companies. They love it. And the main thing through this whole process of pivoting was unemployment was centric to the COVID-19 situation. We all obviously saw the unemployment rate at an all-time low prior to the COVID-19, and all of a sudden it shot dramatically up. But it is the good news is it's coming down, and it's kind of been steadily coming down. New jobs are being added. Jobs are being added every month. Whether, you know, veterans pick up those jobs or not, we look at it as it's still a great news when there's that kind of forward momentum. But in the process of that, DAV recognized the fact that there were going to be a lot of veterans, specifically disabled veterans, that were losing their employment, either being furloughed or maybe the company was closing and did that early on, any number of things. But if we set up the DAV COVID unemployment relief package where veterans could contact DAV, an online application, they simply fill it out if they are a service disabled veteran, and they can supply DAV with something from the VA that says that. And they can also give us something, either an email or a letter from their employer that they've been laid off or furloughed from their employment due to the COVID-19. They could apply for the one-time grant. That's been going. It's still going. People can still pick up the COVID-19 unemployment relief program information on our main website at dav.org, and it can still be applied for there. So if you're a veteran that is just now learning of it, or someone that you know that you think would benefit from that information, have them go to dav.org and they can learn more and certainly apply for those grants. But again, unemployment was being, employment and unemployment were central and have been central to the COVID-19 situation. And so again, having resources and tools available out there is sort of one of those situations, a double-edged situation where we could have all the great tools and resources, but if no one was hiring, you know, it's one way to look at it. Another way to look at it, though, in the realistic way, and we still have to work to get that message out, because we're still within the situation, even though some companies have, you know, regained some footing. We're not out of this by any means, and so DAV wants to continue with that message to veterans that companies are still hiring. They have been hiring through the process. Where to go? Okay, if you're used to going to a career fair, a face-to-face career fair, and that stops, we have the virtual ones that work essentially the exact same way. You connect and talk to a company live. They like to do live interview. They like to do interviews on the spot. They like to do video interviews. We do get questions from people that say, if I come to a video job fair, and I'm like, it's not a video job fair, it's a virtual job fair. So when they come in, they register, they click on it the day of the job fair, it opens up and it gives them a list of companies to visit. They simply click on the company, say DAV. They want to visit our booth. They enter our booth in a public chat forum. All said and done, it's interaction back and forth. There's a lot of private conversations that we have. We have the capability of doing video interviews with people, so companies do that as well. So Dress for Success, even though it's a video or it's an online or virtual career fair, because you never know. But that's the message we wanted veterans to know and understand, was that companies are still hiring. It's just a different method that they're going through right now. And so all those changes we all have to make. This is no exception to that, but we do a lot of them. Our full schedule, again, is available at jobs.dav.org, and we're continuing forward with that. We're all over social media, whether it's LinkedIn, Facebook, certainly Instagram. We promote our career fairs in a host of ways. Twitter even, there's just a lot of them. I just have this slide here. There were some folks that had asked for the actual website. This presentation, I think, will be made available if you should happen to need that. So where have we come from since June when we rolled out the program? You can see here by the numbers, we've hosted almost 670 job fairs, nearly 230,000 attendees, and the real kicker is that over 150,000 job offers have been extended to individuals. So it's definitely been a great venture for DAV to be there, to be able, and I'm very, very proud that we're involved with this particular thing, because there's nothing better than helping a veteran transitioning out of the military to the next career step, whatever it may be. We have a lot of things on the road ahead, things I mentioned here. The resume project is one of those things. We're going to really involved in the entrepreneurship space in a big way. And again, here's the contact information. I really, really appreciate what you guys do, having me, being able to share some of this information. But if you have any kind of questions, you can reach out to me here at employment@dav.org. And again, my name is Jeff Hall, and I'm the National Employment Director for DAV Disabled American Veterans, and the best of luck to you.
Well, we're at the live Q&A session now. Right after my introductions, we'll go live. If you've got questions, whether they be about healthcare issues or disability benefits or employment issues, educational issues, put them in the chat, send them now. We've got folks screening these, and we'll get them to our live panelists to try to answer your questions over the next hour or so. Jeff Hall is joining us. Jeff, welcome back. Thank you. We introduced Jeff earlier, so let me introduce the other panelists we haven't introduced yet. And let me start with Christina Darrow. Christina is an attorney at Legal Help for Veterans. She focuses on veteran disability claims with the VA. She's got, we won't say how many years, decades of experience, and she is an expert in this field, recognized locally and nationally. She's a member of NOVA, which is the National Organization of Veteran Advocates, where she's an active participant and on committees and chairs. She's been the chair of the Oakland County Bar Association Veterans Committee. Her undergraduate is from the University of Michigan, and her master's is from there as well in social work. She picked up her law degree at Wayne State University, and again comes to this. This is her 11th annual Veteran Summit as well, answering your questions, and always one who the listeners and the participants always enjoy. So thank you for being here, Christina. We also have Michael Smith. Michael Smith serves as the current director of the Washtenaw County Department of Veterans Affairs. Since I always get his title wrong, I wanted to read it right this time. He's been there for over 20 years. He served a total of over 21 years in the Army National Guard and the U.S. Army Reserves. So he has that military background that he brought to this job of helping other veterans get their benefits. Michael's a walking encyclopedia. You'll find that out as he answers your questions later today. He's one of the few people I know who can spout off all the form numbers, so you'll see that happen. He is a past president of various organizations, such as the Michigan Association of County Veteran Counselors, where he was president there for a couple of years. So Michael, again, has joined us numerous times, and we're glad to have him on today's live panel. Also with us is Chris Herman. Chris is a nurse practitioner. We asked Chris to participate with us, and he has for a number of years now, because he has now retired from the VA hospital system. He was down at the John D. Dingle VA Medical Center for about 18 years. So he's a guy who brings not only that medical and nursing knowledge to our panel of experts, but sort of the inside real way it works down on the floors, down in the buildings at a VA medical center. He did his undergraduate at the University of Michigan. He picked up his RN at Henry Ford Health System. He did his adult nurse practitioner certification. He's also been certified by the VA's Office of Disability and Medical Assessment. He's received a number of awards from the Secretary of the VA. And he's a member of the American Academy of Nurse Practitioners and has received one of their excellence awards. So Chris is going to give you that hands-on practical experience. Every year for 11 years, and really along with Christina Darrow and myself and Canton Community Foundation, one of the founders of this summer is Brigadier General Carol Ann Faussone. The general is a registered nurse. She has a master's in nursing and administration. She served in the military for about 36 years before retiring in 2011. We can't describe all of her background. We don't have enough time, but I think I'd point out that from 2003 to 2011, she served as the Assistant Adjutant General of Veteran Affairs for the Department of Military and Veteran Affairs in the state of Michigan, advocating for veterans. And that's what she's done since her retirement from the military in 2011, is she's spent the last 9 years being a veterans advocate and helping at Legal Help for Veterans, where I refer to her as the Chief Fix-It Officer, or CFO. So you've got a distinguished panel here that can answer a lot of your questions. And now let me turn it over to Christina Darrow, who's going to moderate the questions for the live panel and hopefully engage in everybody in some really informative and robust discussion. Listen in.
Right, everyone. We are going to go live, and just for you guys to remember, everybody's muted except for our speakers, so you're not going to be able to talk to us. But there is the Q&A function and also the chat function at the bottom. We've gotten some questions through the chat function, so I'm going to ask our panelists to start answering some of those questions. As you think of them, continue to ask them to us. We'll be happy to help you out. If your question isn't answered because either we ran out of time or maybe it's way too involved and very specific to go into here, what we're going to do is we will reach out to you via email afterwards and put you in contact with the correct person. So hopefully you'll be able to get your question answered, and it'll be, you know, very specific for you and everything. So that's our goal. And also just to remind you too, we're going to send out emails after this, so you will get copies of all of our presentations and also videos of the live Q&A. So if you're not able to write that fast, if you're anything like me, at least you'll still be able to listen to it and hopefully have your questions answered. And just for you to know, I've got my second screen and I'm reading off of it, so that's where I keep on looking at when you see what I'm doing here today. But let's get started. And I think our first question is, we can go to General Faussone, if you wouldn't mind. We have a question about, if a veteran's wife passes away before him, will she be eligible to be buried next to him at the National Cemetery because she's not in the military?
The answer is yes, but there's a couple qualifications or criteria. He has his DD 214. It was honorable. They have their marriage certificate. And I think the answer is yes. And we've got ebooks out there to tell them all those particulars and everything else they would get. I think the real thing that's really important is to also communicate and for the burial of the veteran, work with the funeral home who is extremely knowledgeable about all of the benefits, including burial benefits, and particularly the VA picking up some of the expenses for the burial of the veteran.
All right, great. Next question, actually, Jeff, I'm going to give you a two-parter if you don't mind. The first question that came in is just in regards to your presentation. Do you have to be a member of the DAV to get help with employment through the DAV? And then the second part of that is, what are the biggest challenges that veterans and their spouses face trying to find employment now since we're in the middle of a pandemic?
So the first question, no, you do not have to be a member of DAV to receive any of our assistance, whether it be help with your VA claim, or you need a ride or something like that to and from your medical appointments, or any of the employment assistance that I had talked about through my presentation. So no, you don't have to be a member of DAV. Of course, if you're eligible for membership at some point, we would certainly hope that you would entertain becoming a member and joining our ranks. The second part, a lot of it I talked about in the presentation, but just sort of a recap. The biggest challenges I think that veterans and their spouses were facing still are in many ways during the pandemic was just simply how to go about job searching. The physical component being removed or taken away was something that we all had to get used to. As I had mentioned, I was used to traveling every week to and from career fairs as an example, and that completely halted to going to a virtual. I think it took a little while for the word to get out. And in many ways, I think it still has much ground it needs to travel to get the word out. That is, companies, again, they've been hiring through the process and they're continuing to do so. So the challenge is getting veterans connected to that process, whether it be our virtual career fairs or simply them understanding that companies, there's still ways to engage companies, just as we are doing here in this complete presentation, which is probably new for you guys to do it this way. We're all learning how to do business and deliver our services, whatever that may be. Same thing with hiring. So I think the biggest challenge still remains the veterans simply understanding how to go and connect with companies. Our virtual career fairs is just one of those ways.
Chris, I have a two-parter for you as well that came in. The first is, and they kind of go together, can I keep my private sector provider and still use the VA? And then the second part that goes in, one of our chat questions today is it advisable to veterans to have, or for veterans to have a Part D program if the veteran must have brand medications? It's understood that veterans may receive services at a VA facility and obtain generic medications at a reasonable cost. But what way can they then obtain those medications through VA if it's coming from their private provider?
In answer to the first question, can you keep your private insurance and use your private providers? Yes. Many veterans use both. When I was in primary care, I frequently co-managed many of my veterans with their primary care providers in the private sector. We would coordinate care and I would work with their primary care providers or their providers in the private sector as long as I had the information. One thing that is important when you are using both the VA providers and private sector is that you assure that the VA has the information that you get from your private provider. And in the day of electronic medical records, that's usually pretty easy. An example is when let's say you're seeing a cardiologist. Anytime you have a test done, such as an echocardiogram or any other type of procedure, ask for a copy of that from that provider and bring it to your next visit with the VA provider. And that way the VA doesn't have to duplicate services, and everyone's on the same page. This can also be done if you're using My Healthy Vet to communicate with the provider at the VA also. And you can share services. Sometimes it's cheaper for you to get prescriptions through the private sector than to pay the $8 copay if your medicine isn't for a service-connected condition. So that's where it becomes important for you to be a smart prescription consumer. Check and see which is cheaper. Is it cheaper to get it through the VA, or is it cheaper to get it through your local pharmacy with your current insurance? This ties into the Medicare Part D. It is difficult to answer the Medicare Part D without knowing how much your prescription costs are. I recommend, which I have with many of my vets, and I've done myself while I'm not a veteran, I've had to look at my prescription cost and then shop around to find out where I can save money. You have to realize CVS and Walgreens are out there to make a profit, so keep that in mind. So ask what the price is for this medication. Work with your providers. Are generics just as effective? Some are just as effective, some are not. And if that's the case, then the VA has to determine if the research and science supports the fact that a brand name is better than the generic. We've done that in the old days with some forms of Coumadin. There were some generics that were not as effective, and that has to be based on good science and research. Certain new medications used to treat specific conditions, and all the new blood thinners that are out, if you've had heart stents or certain heart things, heart conditions, you may be a candidate for that, but your VA provider is going to have to submit a special request for what's called non-formulary or a higher tier medication. And you can work with your private sector provider and your VA provider. There is a way to do it. But I want to reinforce you have to do your homework as to where it's cheaper. So there's plenty of prescription assistance programs out there. I don't have any stock in Kroger, but I have saved probably $1,000 a year using the Kroger Pharmacy Savings Club. I'll use an example. My Advir for my asthma, if I went through Blue Care Network, it's $250. If I go through Kroger Pharmacy, it's $20. I like to have an extra $230 in my pocket. So you need to do your homework. So I hope that answers your questions.
We do have a question on VA mortgages, but it's pretty specific to the veterans' own circumstances. So he did provide us with an email. I'm going to reach out with him afterwards to put him in contact. Actually, Michael, that's going to be you. So you're going to be getting the email to be able to answer his question on the mortgages after this, so you can be a little bit more specific with him. But I do have a question for you, Michael, in regards to monthly disability payments. A veteran wanted to know if his wife is entitled to survivor benefits of his monthly benefits if he dies before her. So can you maybe explain the different scenarios where that could possibly, work out for them?
Yes, thank you, Christina. So when we talk about, and a lot of veterans are concerned about whether or not their survivors are going to receive a portion of their disability compensation. And actually, no. So let's just say that outright. They will not receive a portion of the veteran's disability compensation, but there is a benefit to survivors called dependency indemnity compensation. And there are several ways by which a survivor can be eligible for that. The one is if a veteran unfortunately passes away as a result of a service-related disability, regardless of the percentage, A veteran can be 0% service connected for a heart condition. And if that veteran passes away as a result of that heart condition, that survivor is going to be entitled to dependency indemnity compensation. One of the other ways that a survivor can be entitled to that benefit, which we affectionately refer to as DIC, because dependency indemnity compensation is a mouthful. The other way in which a survivor can be entitled to DIC is if a veteran has been service connected at the 100% rate, permanent and total, for a period of 10 years or more. And if the veteran passes away as from any medical condition, even a medical condition not related to military service, that survivor will be entitled to dependency indemnity compensation. That rate right now is a little bit over $1,300 per month. So it's not, if you can imagine a veteran receiving the 100% rate with a eligible dependent spouse, that rate is going to be about $3,000. So for that survivor, it's going to be a little bit less than half of the entire 100% rate. Yet, there's another benefit that we like to always highlight for those who are eligible for DIC, and that we call the 8 and 8 rule. And that's this: if a veteran was service connected at the 100% rate, permanently and totally disabled for a period of 8 years prior to death, and that surviving spouse was married to that veteran for that same 8-year period, they will be also eligible for an additional monthly benefit on top of the basic DIC rate, which brings it up to close to $1,600 per month. And if they're in regular need of aid and attendance, meaning they need the assistance of another person for activities of daily living, they could also qualify for an additional benefit based on the need for aid and attendance.
Actually, Jennifer, if you can kind of piggyback on that. We talked about the DIC benefits. We've also talked about burial benefits. Can you also go into the aid and attendance benefits, but the non-service connected pension portion for the spouses? If you could kind of give a brief overview on that, since that's income based.
Yes, there is another survivor benefit that's called survivor's pension. Now, survivor's pension is similar to the veteran's pension in that the VA pays that benefit under 3 categories. There's a survivor who needs the pension because of a lack of income from other sources. Then there's a survivor who the VA is considered or is considered by the VA as being housebound. And then there's a survivor who's in need of aid and attendance, meaning that they need either an in-home care provider, they need to be in an assisted living facility or a nursing home facility, or in essence, a protected environment, and receive the assistance of another person for any of the activities of daily living, such as medication administration or medication reminders, bathing or personal hygiene, cooking, feeding, ambulating, dressing and undressing, transferring from sitting to standing, or standing to sitting, or assistance with their financial obligations. This is an income-based entitlement. The VA has what's called a maximum annual pension rate for every one of those 3 categories, either a surviving spouse who's in need of the survivor's pension because of a lack of income, or a surviving spouse who's housebound, or the highest allowed maximum annual pension rate is for a survivor who's in need of aid and attendance. It's that category that we really like, because under the other categories, the VA will consider certain medical expenses, but they're not really enough to get that person's annual income below the maximum annual pension rate, because the pension is not a lot of money. It is income and asset based, meaning the VA considers income from all sources, including Social Security, as well as any assets like bank accounts, savings and checking, any retirement incomes from other sources, any investment or dividend income from stocks or bonds. So if a surviving spouse's income is above the maximum annual pension rate, yet he or she has to go out into the market and pay money out of the pocket to secure their medical need for aid and attendance, the VA counts that expense along with any medical insurance premiums or healthcare insurance premiums, and they will reduce countable income by the amount of money that they pay out of pocket for that medical need for aid and attendance. And in most cases, it gets that survivor's income below the maximum annual pension rate or all the way down to zero, where then in that instance, the VA pays the maximum monthly benefit for a survivor in need of aid and attendance.
Wonderful. Thank you for that. General Fasson, can you kind of piggyback? I know with your position at the Michigan Department of Military and Veterans Affairs Agency, hopefully I got that right. I always forget all of the listing of it and everything. Can you talk about state veterans homes? I know that Ms. Zarbi discussed it a little bit today, but can you go into a little bit more depth? Are there state veteran homes in every state? Is it just in Michigan? You know, how is that working?
The state veterans homes are in every state. And what a great opportunity for veterans. And as Zenita talked about it, when I was at the state, we only had 2, and we tried, as Michael knows, we tried many times to put out, the proposals to develop 2 or 3 additional veterans homes in the locale of where the individuals lived. I would always get the calls from the wives on the east side of the state who said, it takes me 8 hours to get to Grand Rapids. And how do you visit somebody, in a day? And you can't do that. So the state veterans homes are a treasure. Some states, like down in Florida, I believe they have 11 now in Florida. And it's a funding issue. It's a state funding issue. But they are awesome facilities to take care of veterans, whether they're in the activities, the healthcare, the needs are ranging all over the board. Now, we were very fortunate at Grand Rapids to have a domiciliary unit. And I, in my days, I think I remember we could house as many as 40. So you think about men and women, predominantly men, who would have a place to live. They would have food. We assisted them with trying to get employment. So I don't think enough people pursue the opportunity of the state veterans home. And they shouldn't be treated as nursing homes, but they're a great place to get care. And I look at it as start and think about a village. You could go into there and you could be very independent and then need additional care. But they are great facilities, and no matter where you are in the country, I will call your Department of Veterans Affairs, see where your veterans homes are located, go to the website of any state. We could call them up right now, state veteran homes. So they are a great resource, Christina.
And okay, we have a quick question. Actually, I'll just answer it. A veteran's private doctor was stating that he has early signs of neuropathy in his feet and he's service connected for diabetes. And he wants to know if that's a cause for a review of his benefits. And quick answer is yes. Everybody's nodding. We all know it. So once your doctor is starting to tell you that you are getting complications from your diabetes, you definitely should be filing a claim with VA for an increased rating. Peripheral neuropathy is a big one. You'll get diabetic retinopathy where you have problems with your eyes, diabetic nephropathy. Some veterans have erectile dysfunction. There's a whole host of known complications that arise with diabetes. So it's not just making sure that VA service connects you for the diabetes portion, but also making sure that you're compensated for all the known complications. So if you're starting to get those symptoms, you've definitely got to file an increased rating for your benefits.
Hey, Christina, just to follow up from, in the beginning few questions were all about death and the veteran dying and burial benefits. And Michael, you described, as always, DIC extremely well. But there is something very simple out there that I think a lot of people don't know about. If a veteran dies and there's a claim in process, it's always been said, the rumor, when the veteran dies, the claim dies. False. A spouse should, within 1 year, do what is called the substitution. And so then they will continue to adjudicate, look at that claim as if the veteran was alive, if it gets in the spouse's name. So I just want to point that out, that the claim isn't dead when the veteran dies if there's a dependent.
Great, no, that's perfect advice. Okay, Jeff, I have another question for you, please. Especially now, I think in COVID, at least we've been getting some questions from some of our clients. I know that some of the listeners are having it. What about those veterans who may be thinking of starting their own business?
First, let me give you a disclaimer. I got people outside the house, and my canine colleagues over here are going crazy, so I apologize. I'll try to get through it uninterrupted here. It's an excellent question, one that we're getting more and more about. And I think COVID had somewhat of and I'll just say a positive impact. Maybe somebody was thinking of jumping from their current job into starting that business they've been thinking about for a while. And maybe their current work situation forced them into that situation. So it's not all bad. There are some silver linings in that, to where there are many veterans out there, especially service disabled veterans, that have been thinking about starting their own business, but maybe they just don't know where to start. There's a ton of resources, and I'll tell you one primary resource that is often overlooked, and that is through the Small Business Administration. A lot of people reach directly for the Department of Labor, but the Small Business Administration just has so many, they're very deep in resources and things like that, and answering the most elementary questions that veterans may have. A couple in particular that DAV is involved with are the Institute of Veterans and Military Families out of Syracuse. There's there are other universities that are part of the program, but there's a host of ways you can get involved. And I would simply go to their website, the Institute of Military Veterans and their Families, because they have different programs, whether, they range in different length and things like that. It depends on what the individual needs, how far along they are. Are they just have an idea? Do they have a business plan? How far are they a business that's up and running, but they need additional footing and support, feedback, different things like that. So there's various levels that people can get involved. We've been involved with the Institute of Veterans and Military Families for a number of years, specifically their entrepreneurship boot camp for veterans with disabilities. And we provide a monetary award every year. Now it's called the Vet Edge Conference. In fact, that was the last conference I attended before COVID, was in Dallas at their Vet Edge Conference, and it was a huge gathering. Probably not the most ideal, but I think everything was on the fence of, are we, going to contract this? Am I going to spread it? Whatever the case may be, everything was right at the tail end of coming to a close and people being locked down. But I was really thrilled to be there and offer, a $10,000 award to an individual that's had, he's very successful. He's a service disabled veteran who owns, the company's name is 6 and 20 Distillery out of South Carolina. The guy has a lot going for him in way of his business, and he's a lot further along than some, but at the same time, he still needed that extra push. So DAV was happy to award that to him, and I was happy to be part of that. But there's just a slew of resources that you can get through Institute of Veterans and Military Families. They're a great group to work with. The other one I'll mention, Patriot Boot Camp. It's a much shorter program, but your takeaway from that is much different than a full 6-week program or something like that. Patriot Boot Camp is one where you apply for it, one of their programs. In fact, we were going to be hosting a Patriot Boot Camp here in Cincinnati. It was going to be in October, but we had to cancel that, unfortunately, due to COVID. And we're going to look to do that at a later time. We're also looking at the possibility of doing a 2-day virtual entrepreneurship program, and stay tuned on jobs.dav.org, which is where we will announce that if we're able to get that up next month. Patriot Boot Camp, they take them, they're application based. They take those individuals and they take them through a very rigorous 3 days at their physical events that gives them the tools, the resources, and really what I find as the key, mentorship with successful business owners to those that are out there, corporations, whether it's in the tech industry, finance industry, whatever the case may be. And so for those veterans who are thinking about it, it's probably a good time to be thinking about it. Today, we live in a time where the resources are very abundant for those individuals that want to start their own business, especially for service disabled veteran-owned small businesses. You know, the last point I'll leave on that is there's a lot of veterans that want to do federal contracting. And there is a lot of money available in the federal contracting arena by all means. So DAV, we had done, it's always been of high interest to us to, for service disabled veteran-owned small businesses in the amount of federal contract set-asides that are available. And there's only 3% of federal contracts that are set aside for service disabled veteran-owned small businesses. And, coming up through I've been with DAV almost 30 years. This issue's been alive and kicking for probably as many years. Why is it only 3%? Why isn't it more? And so that's always been a longstanding resolution of DAV that we try to get Congress to push for either a higher amount. And what we have found through that process is accountability is one of the main culprits of why something doesn't work. I think that's just life itself. But federal contracting itself seemed to lack the necessary accountability. We did the first of its kind study. No one has ever studied this particular process. We did that and did a full research study where we got the findings of it at our midwinter conference, which again was about 3 weeks before we went on lockdown for COVID. So we're in the process of compiling that, and that's going to be made available in a variety of ways. But the main direction of that is to take all of the study, pull out the best points of that or the main points of that we can lobby Congress and we can say, hey, this needs to be better. This needs to be improved in way of accountability. There needs to be more, whatever the case may be. That's going to open the door for more federal contracting for service disabled veteran-owned small businesses. Interesting, when we were in DC getting the presentation of the research study that took about the better part of a year, 14 months to get that compiled, as we were getting that at a roundtable discussion, we were actually sitting a week later, the week earlier to the day, the Pentagon had released a statement saying that nearly $1 billion, it was 800 and some million dollars that was meant for service disabled veteran-owned small businesses was actually misallocated to those businesses that were not eligible for that funding. So as we're studying this whole problem and that it needs to be better, the Pentagon releases exactly what we had been kind of feeling, that there was a lot of problems with it. So there's a lot of work to go on that. But all in all, tying it all up in a bow, we have a lot of those resources available on jobs.dav.org that I mentioned, Institute of Veterans Military Families, Patriot Boot Camp, and be looking for more to come on the service disabled veteran-owned small business in the federal contracting circuit. But thanks for the question.
Jeff, if I could caveat on that, here, Michigan, Ohio, and Indiana has Vet Biz Central. Mm-hmm. Vet Biz Central is located in Flint, but it takes care of the entire state of Michigan, Ohio, and Indiana. They are a collaboration between the Department of Commerce, Department of Labor, Small Business Administration, and the VA. And mm-hmm. they assist veterans who are interested in establishing their own businesses, specifically service disabled veteran-owned businesses. And they provide sponsorship, mentorship, education, entrepreneurial training. They have an online template where you can actually complete your business plan, and then one of their counselors will go over your business plan with you, locate any potential sources of funding, any potential sources of sponsorship and mentorship. They provide educational and entrepreneurial training around the states at various venues and locations. And then, of course, yes, once you get your veterans own business up and running, they get you registered so that you can compete for those federal contracts. And you're even on an email list where you get emails from Vet Biz Central for those contracting opportunities for your service disabled veteran-owned business. So Vet Biz Central is a huge resource for veterans who would like to pursue entrepreneurship.
For you, what should I do if I have to go to a community ER? And probably the next follow-up would be, how do I get reimbursed when I do go to a community ER?
Those are good questions. And you go to the closest emergency room if it's a matter of life and death. Obviously, VA obviously wants you to go to their ER if you can. But if you do have to go to an emergency room, then within 72 hours, you should notify your primary care provider that you had to go to the emergency room and what you went there for. Also, and I'm going to read from the community care guidelines so I can be specific, and I can provide these to anyone via a link, or I will send them to Christina and she can provide them for you, but it's a good website to have. So if you're being seen for a service-connected condition, such as you're service-connected for your knee and that knee gives out again and you need to, and so you go to the emergency room, that will be covered in full. If it is for something else, there may be a copay. Now that copay will depend on your benefits and things like that. But then you need to once you get a copy of that bill, you need to make sure you forward it to the VA, the business office or billing, or both, and keep a copy. Also find out who you talked to, who you sent it to, because things get lost. That's just the nature of any business, it's just not the VA. And then then they will guide you on that. But in addition to contacting your primary care provider, also contact the business office or billing. Primary care providers have a lot to do. Not all of them are savvy on what to do with that type of thing. I used to document in my charts that when you called me, all right, Mike called me, said he blew out a knee, had to go to the ER. I documented that in the chart just so it's in your chart, and that helps with claims later on. So that's important to know. Let's see, if it's non-service connected, well, just as I said, send that information in. To receive this, you have to be enrolled in the VA and receive care within a VA facility during the 24 months before emergency care. So take a look at that and take a look. The guidelines are care was provided by an emergency department. It was of such a nature that you would reasonably believe that any delay in seeking attention would cause their life or health to be placed in jeopardy. The VA facility wasn't reasonably available to provide care. So they'll let you know how much is, if it's not for a service-connected condition, and you can go to a local VA, it'll save you headaches to go to the VA. So that's what I recommend. So that should take care of it. I hope that answers it. Again, stay on top of it. The local business office or billing. It's a good idea if you are living in the community and using community services that you get to know your VA's billing department, and they can guide you accordingly. Mike, Mike or Jeff, do you have any other guidance on that? Okay.
No, I think you hit it all right. And I would just tell you that I get all my care at the VA, and I recently had an emergency situation, and the ER is halfway between me and the VA because I felt that I thought it was a heart attack, and my wife wanted me. She was set on me going to the VA. We received great care. That wasn't the point. But I was like, look, I made that decision the best I could to say, hey, I don't want to travel twice as far but not make it, so just get me in here. And the VA was great. I handled it, they had to keep me overnight. They did all these tests and angiogram and everything like that. And as soon as I was able, just let my primary care know. And, they certainly took care of it. And I'm not going to say that that's representative, that everybody's going to have that easy of a time. I do realize, as you guys do, every case can be different, and geography plays a main factor sometimes, unfortunately. But you've given great advice there. And I would just say that crucial thing there is, if you or whoever it is, whether it's your spouse or someone with you, a caregiver, can let the VA know as soon as possible. That timing is the biggest thing.
Well, as a nurse and in the emergency room a lot, Jeff, what you just said, I want to take it a step back. Whatever emergency room you go into, identify yourself as a veteran or have the spouse identify it to a social worker, your nurse taking care of you in the ER, and that ball needs to start right there. An individual in that community emergency room should be the one that places the call to the VA. They get a number, and it's really efficient, very efficient. And I see the least amount of problems when that happens. For a poor spouse to try to get on the phone and call that special VA number, there is a number, and I want to say it's in discharge planning or social work, that you're supposed to call. I don't have it at my fingertips. We could get it as a follow-up, Christina, but I will tell you, communicate, because you don't want to be hit with $100,000 bill because you were in the ICU. But through all the good communication, I know veterans had to pay nothing. And so that's the best way to keep that going.
And this is going to be a free for all. We're going to see how you guys handle it without directing it at one person, testing you guys out. If you are service connected and a combined rate of 70%, do you still have an income limit to meet in order to get into a veteran's long-term home?
I got nothing on that.
I'm not really sure I understand what the question is. Maybe, is that the full question? Is it a loaded question?
Nope.
It's a loaded.
Something lost, because I would ask, did they apply for TDIU? When you get to 70%, if you're not able to work, that entitles you to other benefits. So I agree, Jeff. I think I'm lost what the questionnaire is trying to get at.
I think I understand.
Okay, good. Michael, you do.
For the VA to provide contracted long-term nursing care for a veteran, they have to be 100% permanent and totally disabled. And their service-connected condition has to be the medical conditions requiring that long-term nursing care. For the veterans' homes, and General Fasson, you can correct me if I'm wrong, I believe those who are 50 to 100% service-connected are allowed to be in a state home for veterans at no cost.
They follow the VA rules, Michael. You've got that correctly. A little different than, TDIU, because that's 70% or greater. But in the veterans home, I do know they look at income, they do the sliding scale. So they go out of their way to provide a safe and a quality home for that veteran who's applying for the state veterans home. And I would say, to be really honest, we need to look at each case individually and what the veteran is going through at that time, because he or she might not have had the resources to have a Michael Smith in your backyard to even apply for benefits. I knew when we got them to the state veterans home, we would have veteran service organizations coming there a couple days a week to apply for benefits that they never knew they were entitled to. And we got different individuals into the veterans home in some of those conditions. So you just really need to reach out.
I would say that if a veteran who's currently 70% service connected or has a combined evaluation of 70% and is now in need of skilled nursing care because of one or all of those service connected conditions, that would warrant a request for a reevaluation. Yes. Because it's potential that those service connected conditions, now that they are so severe that they require nursing home care, could be increased on the schedule of rating, where the veteran then could be rated at the 100%. And then in that instance, the VA can provide that skilled nursing care under contract in the community.
And in response to both General Fasson and you, Michael, I know I've done many cases like that, where they are, and as you're filing for an increase, also file, as General Fasson said, unemployability for each of the conditions. As a compensation and pension examiner, I have to address each one of those and what the limitations are. And when you yourself go, or when you go with your spouse, and frequently in these cases, the spouse is your advocate, even in not these cases, our spouses are our advocates, then it's important to document what you cannot do at home. And that needs to be included in that exam. Mm-hmm. And because it's the exam, and your increase is only as good as the examiner's documentation. And I normally don't know what happens after I examine a patient, but with good documentation, it can improve the ratings.
Yes.
So. You're muted, Christina.
Yeah?
Nope. Yep. Yep.
Okay. We have a quick question that came through upon registration, and I will just answer it very briefly. The veteran wanted to know some information about service-connected hearing loss and how to qualify for hearing aids if you don't meet the VA income requirements. So just briefly, without getting too far into the weeds, in terms of healthcare, there's 8 tiers of healthcare that you can get. There's a lot of criteria that goes into where a veteran would place on the 8 tiers, income base, period of service, awards and commendations, service-connected disabilities, all those things start coming into play. So I believe what the veteran is asking here is if he does not qualify for those, and he needs to rely on trying to get health care in a different way, or hearing aids in a different way, because he doesn't want to pay for them through VA. The other way of doing that is to get service connected for hearing loss. And if you put in a claim with VA and your hearing loss is determined to be service connected, then you get free health care for your hearing loss, and you get then free hearing aids. And that goes for basically any other disability. So once you get service connected for something, you get free health care for that particular disability. And then once you reach a combined rating of 50%, so all of your service connected disabilities get added together, you reach 50%, you then can get free VA health care for whatever disability you have, whether it's service connected or not. So those are kind of nice little numbers and benefits to keep in mind that, if you're service connected for your knee and you have you go into VA for treatment, you can get a free brace for your knee, you can get free PT for your knee, things like that, because you're service connected. Once you reach the 50% mark, where all of your disabilities combine to be 50%, you can then go in and get treatment for whatever condition you want, and you don't have to pay for it. So that's kind of the short answer for that. In response to our next question, actually, Michael, if you could kind of take over it. It's pretty timely, but how is the VA benefits arm handling extensions for filing deadlines due to COVID? Formal claims appeals, can you go into that, especially now, not only with COVID, but with the mail that's going on, because it's kind of combined for all of that?
Certainly. So on March 13th of 2020, the VA actually authorized extensions on filing formal claims, filing appeals, and addressing responses to statements of the case or supplemental statements of the case if you are already in appeal. As you know, the VA does have deadlines for submitting certain documentation and claims. So if an intent to file was submitted, claimants have up to 1 year to submit the formal claim. If a veteran receives a denial or receives a decision that they disagree with, they have up to 1 year, again, similar to the 1 year period to file a formal claim. Under the appellate process, they have up to 1 year to file their appeal, whether it's a supplemental claim lane or a higher level review or direct appeal to the Board of Veterans Appeals. And if you're already in an appeal, and the VA issues a statement of the case or a supplemental statement of the case, there is a certain time period, 30 to 60 days, by which claimants have to respond. 13th, as I said, of this year, the VA authorized extensions for filing anything. If you go beyond the 1 year deadline to file a formal claim, if you go beyond the 1 year appellate period, or you go beyond the 30 or 60-day response period for a statement of the case or supplemental statement of the case, or for submitting any medical evidence related to a claim, the VA will allow extensions beyond those filing deadlines. And what claimants have to do is merely request the extension when they actually do file their paperwork. So if you're beyond the 1 year period to file a formal claim, you merely submit a request for an extension when you do file the formal claim. If you've gone beyond the 1 year appellate period and you engage any one of those 3 lanes that are part of the Appeals Modernization Act, the AMA, you again request your extension at the time that you file or submit those documents. Similarly, when you respond to a supplemental statement of the case or a statement of the case, you can request your extension at that time. In addition, if there are filing deadlines for submission of evidence, claimants can either do it in writing or they can call the toll-free number at 800-827-1000, again, 800-827-1000, and they can request extensions telephonically as well.
Good advice. And we have about 5 minutes left, so I'm going to ask a couple of the last minute questions that were coming in when people were registering and things. But General Fasson, if you can go into, there's actually 2 questions that I think would be best for you to answer. You touched upon TDIU, which is very, very important. Can you also give some of the numbers, the percentage rates for VA that give you like some other extra benefits, with dependents and taxes and things like that?
Sure. So I'll go through a couple very quickly, and I'll start at 0%, because veterans get really upset sometimes. They say, oh my God, I got 0% service connection. Yes, you're not getting any money, but if that condition gets worse, let's say a knee, something, your heart, it's already been proven you got the 0%, it was service connected and it related to the service. The next big number is 30%. At 30%, you could add dependents, whether you have spouse, children, up till the age of 18. The next one, Christina, you alluded to it, it's huge. 50% disability rating get you health care across the board, not only for that disability, but for any. 70% will get you the opportunity to apply if you're unable to work for TDIU. And then, as we heard from Sania, and we're all aware, you could start to apply for that assisted living, that long-term care that is, as we all know, so expensive these days. When you get to 100%, if you're totaled and disabled, the other thing that we haven't even mentioned is in some states, in Michigan, you could become tax exempt on your homestead. And taxes, as we all know, is huge. And then this is one of the areas that the widow, should you die and you have gotten this benefit, it will continue on with the spouse in the same household, in your same homestead. So those are a breakdown of the numbers and the percentages.
Jeff, another question for you, and I know you went through a lot of this in your presentation, but I think it's really important, and just to kind of hammer it home and maybe go into a little bit more depth. Where can veterans find resources on finding jobs? And then also, in terms of the information that the DAV has available, you mentioned a couple guides during your presentations and things like that. Where can the veterans definitely go to find all of that information?
So the internet, number one, is full of a lot of different avenues people can do in the job search. And again, it gets into a lot of those services that are available in, you know, Indeed, Monster.com, a lot of them that are available that most people know about. In focusing with what we do, we have a job board available, which again, I mentioned during the presentation, but just to take you in a little more information on that, if you go to jobs.dav.org and you click on the Veterans and Spouses tab, and of course, when we originally set that up, it just said for, you know, veterans. And we realized, you know, it was never to eliminate spouses. When you're dealing with IT and things like that, they try to be creative, and they're not really creative because they're IT, right? They're tech people, but they say it's got to fit in this box. It can't be any bigger than this, right? And so a guy like me comes along and says, well, I want it to say veterans and spouses. Finally, we got that because I wanted to make sure that spouses knew that all of our assistance and services are available to them as well. So anyway, click on the Veterans and Spouses tab. And again, we have direct links to companies that we work one-on-one with, whether it be, if you click on Fiserv as an example, it could take you to their immediate job board specific to their company, and a host of those things. The job boards, the job search board that you see there, those are companies that put those jobs in there. They have to pay to put their jobs in there to Recruit Military, our partner. But once those jobs are in there, you can search. And again, you don't have to register. You don't have to do anything. Any one of you right now could go to that tab. Maybe someone contacts you and says, well, apply for a job, you must register. So that's going to be the key there. But keywords are the important thing. And as I had mentioned in my presentation, I used a couple of examples. One being logistics could be broken out into 4 or 5 different or more career paths. So just be creative in what you're searching for. We've had a lot during this pandemic of people that are wanting to search for remote work. Clearly, we're all remote. It's a very important thing, and we didn't get the question that often. What we tell people is, if you're looking for, you know, some sort of job that you can work from home, in the location, put remote. You know, because it doesn't matter if you live in California or Michigan, the job may be somewhere else, but if obviously remote is remote, so it doesn't matter where you're physically located. So just be creative with those things. And again, we're always evolving the types of resources and things that we have available on our website. And I want people to go there at jobs.dav.org and connect with many of those things. The other one I would tell you is go to Recruit Military, our partner. Go to their website, recruitmilitary.com. Get registered, get your resume uploaded, because companies go there more than they come to us. Companies go there and search for, if you're in their candidate database, companies pay big money to have unlimited search for candidates, and they'll simply go in. And so if we all go in there right now and upload our resume in there, companies will be able to find us depending on what our career field is. They're going to find us. And that is something I didn't realize in the beginning, that probably more companies search for veterans than veterans searching for companies, if that even makes sense. But I wouldn't have thought it in the beginning, but from the feedback we get from companies, that's true. So make sure, and there's a lot of others, but go to jobs.dav.org, check our resources out, and certainly recruitmilitary.com.
One for you, and maybe if General Fasson wants to pipe up too. We've been getting lots of questions on healthcare access and things. And so you had touched upon earlier that you can use both private insurance and VA. But can you go into a little bit of a description potentially, and like I said, have General Fasson discuss it too, where if you're at VA getting treatment, are there any instances where you can use private providers? Does the VA ever allow for that or send you to places?
Well, I think the real important thing is, and it's a beautiful new process. It's called the Mission Act. And if you're working with your provider, and if your provider feels, let's say, whatever the issue is, cardiac, dermatology, if he or she feels you need another resource or a second opinion, you know, another way to handle, they don't do it at the, say, the Ann Arbor VA, but down the road at the University of Michigan, they could do this. They're going to extend that and do the referral. So I think there are many avenues, Christina, out there now with the Mission Act, but you need to keep the VA aware and let them approve you to go on this referral or on this mission down the road, go out of network. Let me just say it, out of network, because then you want the VA to pay for this. You don't want to have to pay out of pocket.
That is very important. I know from personal experience when I worked with the VA, number one, the process is much better in the past 18 to 24 months. But I just spent a week up in the Upper Peninsula where many of the veterans up there depend on VA referrals. And they contact the VA provider, they put in the referral. It's just like any other insurance. And I think our veterans need to understand your VA is an insurance and use it like that. And then they will find a VA, a provider that accepts the VA insurance, and they do the process and they will approve so many visits. There have been some instances that and we'll use General Fasson's cardiology example. You've been under the care of this cardiologist for 20 years. If you ask if you can continue to see that same cardiologist because of X, Y, and Z. He's done all these procedures on me already. He's done this, he's done that. You can see if they'll approve the continuity of care, because that is very important. I'm not saying it will be approved, but you may have some luck with that.
Unfortunately, we are out of time. So I'm going to break now, but there are a couple questions that were asked upon registration. Like I said, that were a little bit more in depth. When everybody registered, we got your emails as well. And so we're going to put you in contact with our panel of experts that's going to be best at answering your questions. So that's our goal today, is hopefully to have everybody's questions answered by the specific expert. So this way you'll have the right information to be able to go on. So we will be reaching out afterwards to do that. Like I said as well, we'll be sharing the resources that have been discussed today. And that's it. I just wanted to thank you guys for being our panelists. And I know we have kind of some closing remarks coming up from Canton Community Foundation. the board president. And so we'll just go from there. So thank you guys. I appreciate it very much.
Thank you for having us.
Thank you.
Thank you all.
All right. And so up next, let me do this if I'm handling technology now. I am, and I'm not sure if he is still available yet or not. I don't see him on here. But we had Steven Snyderman coming back on to kind of do some closing remarks. What I will say, like I said before, he comes on to be able to do so, I just wanted to remind everybody, you're all going to be getting the email afterwards of the presentations. So this way you'll get all of that to be able to know what was discussed. You'll get the slides and everything. All of the resources that have been shared will have it. It will also be posted on YouTube, on Legal Help for Veterans YouTube channel. So if you'd like, you could just go directly to YouTube. You type in Legal Help for Veterans, it'll pop up the channel, and then you can watch it, the entirety of the presentation. And then we'll also put everybody in contact, like I said, with the questions that were asked that we weren't able to get to, and we'll put you in contact with the specific expert. I wanted to thank all of our speakers and panelists today for taking part in this. It's very much appreciated that they take time out of their schedules and also attempt to do this remotely, which definitely puts another layer of difficulty into all of these sorts of presentations. So thank you to Dr. Kriesman, to Zanetta Adams, to Ann Zerbe, to Jeff Hall, to General Carol Ann Fasson, to Michael Smith, and to Christopher Herman for participating today. And then also I'd like to thank the attendees, believe it or not, for coming in. We appreciate you joining us again this year, especially for embracing a new format and also for working with new technology, which I realize is not the easiest to do, but I appreciate that people figured out how to use the chat functions and they were able to log in and hopefully listen. And if you were having problems, again, since we're sending things out by email and also posting it, if maybe your internet went down for a bit and you missed, you know, the presenter that you actually really wanted to hear, you'll be able to still listen to that person once you get the actual links after this has been concluded. So with that, I'll see if Steven's available and just do a little quick closing. Oh. And it looks like he isn't. So actually what I will do is we will just close on down. And like I said, we'll send out all of the information to all of our attendees and everything. I did want to thank everyone for participating today. And if there are any concerns that perhaps we didn't address, if you have any additional questions that maybe popped up after you were listening to presentations, feel free to reach out to us afterwards as well, and we'll be happy to answer those for you or put you into contact with someone who can. And with that, we thank you very much. You guys have a good afternoon. Bye-bye.